Good morning, good afternoon, good evening, everybody, and welcome to the Global Pharmacy Technician Symposium 2023. We're very happy to have you today for this FIP global event. Next. Allow me to introduce myself. My name is Michael Mungoma. I'm the Dean School of Pharmacy, Mount Kenya University. I'm logging in from Kenya. I'm very excited to have you here today. Next. I have a few announcements to make. One is that the webinar is being recorded and streamed live via YouTube. The recording is going to be available on our website. That's www.events.fip.org. You may ask questions using the question box provided. That's the Q&A tab. And you're welcome to provide feedback to webinars@fip.org. And you're also welcome to become a member of FIP through the website, www.fip.org/membership_registration. Next. So today's program, we're going to have 5 parts. We're going to have an introduction, and we're going to have a pharmacy technician immunization services. We are going to have a presentation on advancing global pharmacy practice with advancing roles of the pharmacy technicians, system thinking, and then we're going to end with a Q&A session. Next. So I'm going to introduce my co-moderator. This is Kimberly McKeirnan. Kimberly McKeirnan has a PharmD. She is an associate professor and also a director of Center for Pharmacy Practice Research at the Washington State University College of Pharmacy and Pharmaceutical Sciences. I'm going to allow Kimberly to take us from here. Welcome, Kimberly.
Thank you, Michael, for your introduction, and thank you for having me at this event. I'm really passionate about this work, and I'm excited to be able to speak with all of you today. Here are our learning objectives for the session. So we're going to discuss some evidence-based practices. I think this is so important, using evidence-based material used by pharmacy technicians, particularly supporting pharmacy workflow, which I know is an important topic for many of us. We're going to talk about some innovative ways to include pharmacy technicians in multiple expanded or advanced roles. We're going to describe the potential for more expanded roles for technicians and the potential impact that those roles can have on direct patient care. I'll be talking about the implementation of pharmacy technicians as immunizers and the rollout of that in the United States. And hopefully we can consider the future of technicians beyond the pandemic. And then we're going to hear a wonderful presentation about systems thinking and describing the importance of this in the workplace, and then identifying opportunities to create new habits related to systems thinking in an informed way. And so I'd like to start out with just talking about the rollout of technicians becoming immunizers in the United States. And this has been kind of a long process and has taken place over several years, but we've learned so much from this experience. So I hope that from this presentation, maybe you'll end up with some takeaway information that will be practical and useful to you in your own pharmacy practice. Immunizations have been done by technicians in many other countries, and I don't want to say, that what we've done in the US is any better or worse than anyone else. I just wanted to provide this as an example of what we've done. Next slide, please, Ryan. Great. So to start with, I wanted to go through what are some non-immunizing, more traditional roles for pharmacy technicians related to immunization services. So these are supportive roles and do not involve directly administering the immunization. Here in the US, we have done these for many years, and they're really valuable. So I don't want to downplay the importance of that. So I just wanted to briefly discuss a few of them. So the first, as many pharmacy technicians do in many countries, they're great great at identifying patients who may be eligible for immunizations. We know technicians are often the face of the pharmacy, and patients often interact with them more than they do directly with the pharmacist. So technicians are, they do a wonderful job of having conversations with patients and reaching out to them about, hey, would you like a flu shot today? Did you know we're offering flu shots today? And getting that conversation started. Technicians also have played an important role in scheduling appointments for patients once we've identified that we'd like to immunize them, or maybe they've self-identified that. And they've also, played an important role, and this was definitely the case in my pharmacy previously, of managing the vaccine supply and inventory. So, what vaccines do we have in stock in the fridge? How is that all organized? Do we need to order more? Making sure that we have everything that we need on hand, just like they often do with with our supply for other, pharmaceutical products. Technicians also can be and have been involved in documenting that the vaccine is stored appropriately. So this may involve, checking refrigerator temperatures and doing logs of that, acknowledging receipt of vaccines when they're delivered to us. And then when we go into the immunization process itself, they can be involved in the documentation of aspects of that, and certainly, often more involved than the pharmacist in the billing side of things. I know that isn't applicable to all countries because some are not, probably directly involved in this, but in the US, we're constantly running people's, insurance cards to make sure that the vaccine is covered and we don't have to charge them out of pocket. And this is 99% of the time, the role that the technician would play. Technicians also play a huge role in again, the supply management side of things. So that may mean gathering up all the immunization supplies and making sure that we have all of those available for when the immunization is actually taking place. And then again, connecting with patients directly. So this may be reminder phone calls or emails or appointment reminders, and those aspects to make sure that everything runs smoothly in the pharmacy. So these supportive roles have had a really positive impact on patients in the community setting and the hospital setting as well. So before I go into the direct, administration of the immunization, I just want to highlight the importance of this. Again, the whole presentation that I have is really rooted in the literature that's been published, and there's some great evidence out there that is very important for pharmacy technicians to be involved in these roles that do not involve directly administering the immunization, but are still so important. And so prior to the pandemic, there's so much that's happened with immunizations during the pandemic, but even before that time, studies have shown that there was a statistically significant increase in the number of immunizations administered when technicians are involved in those supportive roles. And so this is so important. If your pharmacy is vaccinating more people and reaching more people with technicians involved in all of these supportive roles, that's excellent for the pharmacy, that's excellent for the patients, and just all around, exactly what we're striving for in pharmacy practice every day. And so I wanted to just briefly describe how this rolled out in the United States. So if you look at the picture on the left, in 2017, the gray area is where technicians were not immunizing, and this really all started in the state of Idaho. That's the blue one here in the picture. And so a friend and colleague, Dr. Alex Adams, who was at the time the executive director of the Idaho Board of Pharmacy, reached out to me and said that in Idaho, they were going to become the first state to allow technicians to administer immunizations as part of their scope of practice. And this, at the time, now it seems like, kind of normal, but at the time, this was a completely novel concept. But I remember being really excited about partnering with him on this. And so my involvement was that I wrote a training program, which to my knowledge was the first one in the United States specifically for pharmacy technicians to learn to administer immunizations. Because there's lots of immunization training programs out there for other health professions. We've had pharmacists immunizing in the United States since the 1990s. So that wasn't new. But really, we kind of started thinking about what would be important for a technician to know about administering immunizations, because the pharmacist versions of the training in the US involved immunology and a lot of in-depth information into the diseases themselves and the vaccines and how they worked. And we thought for a pharmacy technician, this probably isn't as important. Certainly knowledge is wonderful always, but we wanted to make this approachable and practical for everyone. So I worked with Dr. Adams-Wheat, and I developed a training program with some of my colleagues at WSU, and we piloted it in 2017 with 25 pharmacy technicians who were working for a chain pharmacy called Albertsons at that time. And we wanted to just sort of see how it went. See, did the technicians, were they excited about doing this? Were they terrified about doing this? You know, was it a positive experience for the patients and for the technicians themselves, you know, in their role in healthcare? And what we found was just overwhelmingly positive. I remember teaching that initial, it was 2 different dates. We had training one day and then the following day, so that we had the group broken up in half. And so we could do a lot of one-on-one practice. And I remember them just being really excited and nervous, because everyone's nervous when you learn to immunize. I've taught thousands of pharmacy students and pharmacists to immunize, and they're mostly nervous. That's where we all begin. But the technicians were just phenomenal, and I was so proud of the work that they did. So in the span of about 6 months, they administered more than 900 immunizations, which I thought was wonderful, because we have pharmacists that don't immunize, you know, to that level. So yeah, when I was getting involved in this initially, one of the reasons I thought this was so important was for the technicians and, you know, their personal growth and involvement and enjoyment of the workplace, because I knew some very good pharmacy technicians who were great at their job, and our patients loved them, and they sort of hit a limit of what they were able to do as a technician in the United States. So for me to be able to be involved in something where I could give them opportunity to expand that and do something interesting and innovative that they were excited to do, to learn a new skill, and hopefully, you know, every time we add something new to workflow, often that means a pay increase. So to be able to see them do that and hopefully find fulfillment and satisfaction in their job, you know, meant a lot to me. So fast forward, that was 2017. Obviously, the pandemic had a huge impact on this, because prior to the pandemic, we had 3 states that allowed technicians to immunize, and then several states where it was not directly prohibited, but we were still trying to figure out, you know, what direction to take that. Is that something that was going to be widely done? And then when the pandemic hit, this whole thing, you know, just expanded so rapidly. And so in 2023, now this is what our map looks like. In the dark blue there, we have technicians who can administer vaccines in the same way that pharmacists can. So they can administer the same vaccines to patients in the same age ranges that pharmacists can. And then the light blue color, the technicians can administer the vaccines, but there are some additional restrictions. So maybe these are, you know, they can't immunize 2 children under a certain age, or they can't use certain vaccines, but there's still opportunity for growth there. And then in the gray, I just want to prefaces in the gray, there was not legislature at the time when I pulled this, which was about a month ago, in place allowing them to administer immunizations. But I will say, I've recently heard from some colleagues that we now have 49 out of 50 states that either have legislation or legislation is in progress changing the rules to allow technicians to immunize, which makes me so happy to hear and to see this grow so rapidly. So more to come on that. But for now, we're making a lot of great progress. And as you can see, it's just been a huge change from 2017 with my little project in Idaho to here, you know, rapidly expanding across the United States. And so some of you may be wondering, what does a pharmacy technician have to do to be able to administer immunizations? Because this is not a, you know, a baseline procedure where all technicians are doing this right out of the gate when they become pharmacy technicians. So I wanted to show you the language that's been included in, it's called the PrEP Act. It's the Emergency Readiness and Preparedness Act that was enacted during the pandemic. And so this kind of went over the requirements of all the states and said, basically, federally, any state, any technician in any state in the United States is allowed to administer immunizations, regardless of what their state rules were during the pandemic. So now that the pandemic is ending, this will be ending, in time as well. But this really allowed technicians to become vaccinators very quickly in many U.S. states. So I just wanted to note there are quite some important restrictions around this as well. So I don't want this to seem like any technician can just pick up a needle, and start immunizing people. So in order for the technician to be able to immunize, there were some requirements for the technician themselves, but also for the pharmacist. And I want to know also for the vaccine. So the vaccines had to be the ACIP recommended and FDA approved vaccines that were available for patients. So this couldn't just be any vaccine to anyone. It had to be the approved and required ones for people in the United States. And so the technicians themselves had to have completed a training program. I created the first one, but there are upwards of 30 from the last that I heard programs now in the United States teaching technicians to immunize, which I think is excellent. It's great to see that access has expanded quite a lot on that. And so they have to complete a practical training program, and this has to require a hands-on injection technique component. So this is not something they could learn entirely online. You have to have training, being able to actually practice injecting practice vaccine, it's just saline, into another human to show that they can safely do that before they can start immunizing. You'll see on here the language says a pharmacy technician or a state authorized pharmacy intern, so a student pharmacist. That's just the act covered both of those things, so that's why that's in there. But so the technician also had to have been trained in CPR, prepared to do that just in case there was some kind of vaccine related emergency. We know that it's very rare, but anaphylactic reactions do happen regardless of who's administering the vaccination. It doesn't matter if it's a physician, a pharmacist, or a technician. We know that there's the potential for that. So it's really important that we have these technicians ready to recognize and respond to a vaccine-related event. And then technicians also had to ongoingly complete 2 hours of continuing pharmacy education during the relevant state licensing period. And so in the United States, we have 50 states and they have 50 different sets of rules about everything related to pharmacy practice. So some state licensing periods, it's 1 year, and some it's more than 1 year, but the technician had to do some CE or continuing education related to immunization topics to keep that current. And then I also wanted to note that the pharmacist also had some responsibilities around this. So the pharmacist, the vaccine must be ordered by a supervising pharmacist who is trained to administer immunizations. So this could not be, a pharmacy where no one was immunizing, and then all of a sudden the technician is immunizing. These were pharmacies where the pharmacist was already immunizing, and now the technician also was joining that workforce area. And then additionally, and I think this is so important, the supervising pharmacist must be readily and immediately available to the technician when they were vaccinating. So this could not be done through, a video. In some states, in some ways we have where a technician could be remotely supervised through, a video feed by a pharmacist. That was not the case. The pharmacist had to be physically present and on hand, just in case there was any sort of problem. And then also, lastly, I guess with this slide, I wanted to note that there are kind of two different sets of roles as we saw them in Idaho around immunizing. So there are the things that require clinical judgment and things that are more an administrative role. So with the clinical judgment side, this would be things like, is it appropriate for this patient to get this vaccine? Is it appropriate for, this patient to have it today? Or are they on any medications that this might interact with? Or have they had any medical conditions this could interact with? Those things still must be done by a pharmacist. The pharmacist must decide, is this vaccine appropriate for the patient? And then the technical task of administering the immunization is under now the purview of the technician. Pharmacists certainly can do this too, but that specifically is the role of the technician. So I wanted to make sure that this is very clear, that we still have a pharmacist engaged in this process. They're not gone. They're not, stepping completely out of this. It's the technical aspects that are being taken over by a pharmacy technician. And that's just made so much sense from the beginning, because here in the United States, when you go to a physician's office to get flu shot, it's not the physician that's giving you the flu shot. It's not a nurse that's giving you a flu shot. Often it's a medical assistant who has a very equivalent background, and in some ways, the pharmacy technician education can be more robust than that. So I just wanted to outline some of the rules around this, what happens, what the technician needs to follow, the pharmacist needs to follow, and then also that clinical judgment piece. Next slide, please. So since 2017, what have we learned from this? There have been several studies published, and I've been involved in some of those, but others are completely independent of my work. And I just wanted to share with you some of the interesting bits that we've learned since 2017 here in the United States. So starting with the box on the top left, first, technicians can be trained to safely administer immunizations. Now, to me at this point, this seems like a no-brainer, but there really were a lot of concerns from interested parties when I started this work in 2017. And that citation number 5, that is my pilot study from those 25 technicians I was talking about with Albertsons. They absolutely can be trained to safely administer immunizations. And that was, that was a big piece when we did it originally in 2017. And then next, technicians can safely administer immunizations to children. That study was one that I conducted with a colleague, Dr. Greg Sarche, he's within the federal pharmacy system. We trained 7 pharmacy technicians with his team to immunize, and they administered thousands of immunizations in a 1-year period. And many of those were to children. This was prior to the pandemic. And so in the United States, we still at times see pharmacists who are hesitant to immunize children. The children scream and wiggle, and the pharmacists are a little less comfortable with that than they are immunizing adults. Well, the technicians did it, and they did a wonderful job. So I wanted to highlight that because I was just so impressed with them. And there again, this is becoming commonplace, but at the time it was quite something new and different. And so then the third study I wanted to highlight was done by some colleagues of mine here in the US, led by Dr. Bill Doucette. And so he did a study looking at advanced technician roles, not just immunizing, but advanced roles in general. What are some factors that influence technicians to want to do these, and then also have hesitancy in doing the new roles? And so what they found is the technicians were most hesitant to administer vaccines of all the new roles they could potentially do. But a really important takeaway from that is that they highlighted the importance of training, which I think makes so much sense for all of us because, of course, we're hesitant to do things we're not trained to do. So I thought that was a really interesting takeaway that they found, performing new skills really requires training, it requires staffing, and where possible should require some kind of reward or incentive to the pharmacy technician. So technicians are much more interested in doing new advanced roles when there's some kind of benefit that they personally are getting from that. And that can be personal job satisfaction, but we also really love it when they're getting a little bonus or pay increase, or this is making them a more senior technician in their role, or something to reward them for doing this extra work and taking on this new role. And then I wanted to highlight a systematic review paper that was done a couple of years ago by a colleague from Canada. And he, aggregated the data on all of the studies that were out at that time and just found that overwhelmingly this led to positive patient outcomes. Having technicians involved in the immunization administration process was better for patients. And I thought that was great. I think that's really important to highlight. And then moving into the bottom row, some more things we've learned, and these are all studies that are published, and you'll be able to see them on my references slide. But pharmacists, I did the study with my colleague, Dr. Taylor Birch, and he interviewed some of the pharmacists who supervise the technicians to find out how's it going, how do you put this into workflow? Are the pharmacists happy? Are the technicians happy with this? And what we found is that pharmacists believe having immunizing technicians had a really positive impact on pharmacy workflow, and it allowed the pharmacists to prioritize the tasks that they were doing to improve that workflow. And so what I mean by that is if the pharmacist is has to step out of workflow to immunize constantly, they're going out into a waiting room and administering immunizations, that takes them away from other tasks that only a pharmacist can do. And so by allowing them the opportunity to be more, integrated into workflow, staying into workflow, because the technicians were the ones who were going out into the little waiting room and administering immunizations, this was really positive for workflow. So if you want more details about that, the citation will be in my references slide. And so then you may be wondering, what do the patients think about this? I had a doctor of pharmacy honors student who did some interviews for a project, and she interviewed a bunch of patients, something like 40 patients, and asked them what they thought about a technician giving them a vaccine versus a pharmacist. And so the patients said they really trust technicians to immunize, and that includes children. There was no difference in their opinion about whether, do you trust a technician to administer immunization, and does that change if the patient is a child? And it didn't. They were on board, which I thought was great. And then the next one, so pharmacists and technicians believe that technicians competently administer immunizations and should be more involved in direct patient care duties, which I thought was wonderful. This is not a study I did. This is some colleagues that are completely independent of my work and found that to be the case, which I think is excellent. And then additionally, some supervising pharmacists report there was some initial hesitancy after technicians were trained, but once they got going in this, there was some really strong acceptance on the pharmacist side and the technician side, and they thought delegating this task, really improved pharmacy practice workflow, which I think is excellent. Next slide, please. And so, of course, one of the most important aspects of this is not what the pharmacists think, it's what the technicians themselves think about this. So I wanted to highlight some of the things. These are pieces from technicians, and so things that they personally said about this. So first, they're giving more vaccines. More vaccines are being administered in the pharmacy setting because technicians are involved in this. So the quote, more people get immunized having immunizing technicians. I think probably the immunization rate has got to go up, and we've found that very much to be the case. There's also, like I was saying, some improvement in the workflow. So it makes things go a lot smoother if you have a technician actually give the shot and not pull the pharmacist away, as I mentioned before. This whole thing frees up the pharmacist to do other things. And the part of the intent behind this is perhaps long-term, this will free up pharmacists to do other clinical tasks because they're not stepping out of workflow as frequently. Reducing errors. I think this is huge, particularly as we consider the challenges and burnout related to working in healthcare during the pandemic. It reduces errors having technicians involved. So it just alleviates the pressure of trying to do everything on your own and increase the chance of making errors. I think that's huge. Empowering technicians, which, like I said earlier, to me, this was a big reason that I got going in this, is just knowing so many excellent pharmacy technicians and wanting to see them feel empowered and feel like they're a huge critical part of the healthcare team, because they are. And so empowering technicians, here, I think it gives them an opportunity to do something they're more capable of just to enhance their abilities. Great. And then I love this last quote, patients approve. Actually, they all like the technician better than the pharmacist anyway, so that was no problem. And I've heard this many times anecdotally as well, that the pharmacy technicians are often more customer or patient facing than the pharmacist. So they often interact more, where the pharmacist in a community setting may be in the back doing something. And so patients are supportive of this, technicians are supportive of this, and pharmacists are supportive of this, is really what the literature at this point shows. And I wanted to share with you, these are some references that I mentioned during the presentation, if you'd like to read them. You're also welcome to reach out, and I'd be glad to share this with you or chat more about this. I can put my email address in the chat at the end of the session. And then I just wanted to let you know there's also more to come on this topic. Within about a week, I'm going to launch a survey to 6,000 technicians in the United States, asking them, how's it going? I want to follow up with you. You've been immunization trained. You've been working on this during the pandemic. What's new? How do you feel about this? Is it making, your work life better or worse? And, I really just want to hear what their experience has been. So there are more studies coming out on this all the time. But thank you for letting me share this with you. And if people have questions, I'd certainly love to answer those when we get to the Q&A portion of the presentation. So with that, I'd like to introduce my colleague and friend, Kenneth Hohmeier. I don't believe he's here with us today, although Kenneth, if you are here, please mention something in the chat. He has twins, newborn twins that are a couple months old, and a lot going on. So he pre-recorded his presentation, but I hope you enjoy it. So this is Dr. Kenneth Hohmeier, who is a pharmacist and associate professor and director of community affairs in the Department of Clinical Pharmacy and Translational Sciences at the University of Tennessee Health Sciences Center. And he has 4 little children, including twins, new twins. And so he's quite busy. He has an extensive background in pharmacy practice and practice-based implementation science research, practice-based research. He's implemented postgraduate residency training in a community setting, which is quite interesting, and has credentials in several leadership-related roles such as Lean Six Sigma, implementation science, the innovator's DNA, and change leadership. He's successfully established and provides clinical pharmacist services in several community pharmacy settings in rural, suburban, and urban areas. His background also includes extensive leadership experience in practice and within the professional organization space. So he has past and current positions held at local, regional, and national levels in pharmacy practice, including with the American Pharmacists Association, the Ohio Pharmacists Association, and the Tennessee Public Health Association. His specific areas of research focus are in clinical service implementation in the community pharmacy setting, medication therapy management, or MTM as we call it, innovative clinical pharmacy practice models, and he's done quite a lot of work with advancing the role of the pharmacy technician as well. So I certainly admire his work in that area. And so he has served as a primary investigator or co-investigator on 15 grant-funded projects related to advancing the role of the community pharmacist and the technician to increase patient care activities such as vaccinations, MTM, and other clinical services. So I hope you enjoy his presentation, and that will be queued up for you here in just a moment.
Well, hello, everybody, and thanks for your time this morning or afternoon or evening. I suppose we're all kind of joining from different times across the globe right now. Appreciate your attention today. I also want to thank FIP for the opportunity to present here today on a topic very near and dear to my heart, which is the advanced roles of pharmacy technicians, our pharmacy support staff across the globe, a key to providing high levels of clinical care in the pharmacy setting, no matter where you are across the globe. My name is Ken Hohmeier. I'm a professor in the Department of Clinical Pharmacy and Translational Science at the University of Tennessee Health Science Center. Our main hub is in a city called Memphis, Tennessee. I actually reside in Nashville, Tennessee, and am faculty at our remote campus in the middle of Tennessee, which is basically in the middle of the United States, so sort of the middle of the middle. My work over my career has really focused on implementing of new pharmacy models in existing pharmacy settings, most of which have been in the community pharmacy and revolve around increasing communication between community pharmacies and other healthcare providers, implementing medication therapy management, and also point of care testing, to name a few. And sort of the thread that pulls through all of the work I've done is working with pharmacy technicians and studying their impact on what pharmacists can do to elevate patient care. And they are a key catalyst in any type of clinical pharmacy service that we find in pharmacy settings. So with the time we have here today, what I'd like to do is discuss some evidence-based practices used by pharmacy technicians to support pharmacy workflow, to describe innovative ways to include pharmacy technicians in expanded roles, and then to describe the potential for expanded roles for pharmacy technicians and the impact on patient care. So let me start by just saying, let's get excited, because more in 2023 than ever in pharmacy's history have we seen the opportunities for expanded pharmacy technician roles globally. They are expanding at an unprecedented rate, and there's pretty universal support across the profession that the need for technicians to take on advanced roles is a critical next step in advancing what pharmacists do in their scope of practice. You know, in the United States, we've had expanded scope of practice happening really for the past 10 or 20 years, depending on the state that you're looking at. And what we've realized is that's only part of the picture, right? You can continue to expand scope of practice and add to the pharmacist's plate, but if there's not something to remove the tasks that already exist within that workload, you're going to end up overwhelming that individual, and that's certainly where we're at right now. These roles that the pharmacy technicians played were really highly visible through the pandemic. And not only did they really allow for improved patient care, but also this nice side effect of improved quality of work life, you know, enjoying what you do, both as a pharmacist and as a pharmacy technician, which is very exciting. So when we talk about expanded roles of the pharmacy technician, I like to look at it in two different buckets because they're really two distinct buckets. The first is this idea of taking on pharmacist duties which are directly supporting clinical duties. The second bucket I like to classify these roles in are non-clinical support duties. And what I mean by that is that clinical support duties are those things which involve directly the pharmacy technician working in the clinical service. This might be collecting information from a patient prior to a medication therapy management session. This may be procuring a specimen from a patient before they take a multiplexed COVID and influenza point of care test, you know, doing a nasal swab or the like, a nasopharyngeal swab. And we certainly have pharmacy technicians in the state of Tennessee, where I'm located, who are doing these advanced clinical support duties. But that's really only part of the picture. The other part is really stepping up to take on some of these non-clinical support duties. And these things involve telephone triage, making sure that the pharmacist, as simple as it might seem, is not involved too directly in answering the telephones during the day. That can be a large pull of the pharmacist's time. Not that engaging with the patient isn't important. It's just that those sort of spontaneous conversations with patients can sometimes be at the wrong or inopportune moment. And the other piece might be that some of those things really the pharmacist doesn't need to engage in. One of the things we noticed in some of our observational studies is that a lot of the times when the patient asked for the pharmacist, it was because they just knew the pharmacist and they thought, well, that's the person who can do my refills. I enjoy talking to Mindy, or I enjoy talking to Bob, and I just know that, you know, they'll get the thing done. When in reality, the pharmacy technician can take care of that for you. So it becomes something like, you know, the pharmacist is with a patient right now. I'd be happy to help you if I can. Is there something that I can help you with? Oh yeah, I just need to get a refill. And then doing that. Those really simple things, when combined with those clinical support duties, really frees up a lot of pharmacists' time. And this is an example of something that we created in this flow chart based on some of our observational work of these support roles that a pharmacy technician plays within a clinical service. And so you can see here across the different rows, we have different members of the pharmacy team who are playing different roles on the team. The very top, you'll see MTM payer. The next row down is your MTM technician champion, so somebody involved directly in the clinical service. Then you see your staff technician, so these would be non-clinical support duties. And then finally, a pharmacist. And what we found in our top MTM providing pharmacies within this study, within a large national chain in the USA, we found that these top performing MTM pharmacies, that the pharmacist was really involved in only 2 different tasks within the entire MTM workflow. That was the delivery of the service and then providing documentation. And then clicking the final button, maybe you could say, to submit the claim to the insurance company. That was a requirement of the payer contract, but didn't involve more than just reviewing the chart and pushing the button. So really we looked at this as 2 time intensive tasks, and then one which was more of just a had to do because it was contractually required. most of these things were done by the pharmacy technician, row number 2, if you're following along in the figure in front of you. And that includes things like the review of the MTM platform, contacting eligible patients, and then scheduling appointments, and then entering all documentation into the system for the pharmacist to then review. So you can see here a great illustration of how there's this complementarity between clinical and non-clinical support roles taken on by pharmacy technicians. In general, these advanced roles have major impacts across the spectrum of patient care and pharmacy services. For one, they increase medication safety. For two, they improve patient outcomes, including prevention, things like immunizations, point of care testing, treatment, test to treat influenza programs would be a good example of that. And then medication use, things like adherence. And then in the little colorful boxes, you see just a variety of different roles that we've been able to engage in, both in the United States and then also abroad as well. These new advanced roles that technicians are engaging in. Administrative roles, collecting patient information, billing and documentation, immunization administration, again, really highlighted during the pandemic. Point of care testing, including specimen collection, which is a new role for the pharmacy technician, at least here in the States. I know that's not true in many countries, but we're still kind of catching up with other countries across the globe. Medication therapy management, like I just shared with you. And then this thing that's also very near and dear to my heart called technician product verification, which is where the pharmacy technician is involved in verifying that the right product was selected within workflow. In the States, that's a key piece of what pharmacists are typically required to do, and takes about somewhere between 35 and 45% of the pharmacist's overall time in workflow, at least in the community pharmacy setting, is just making sure that the right product was selected in the product fill process. What we're able to do in many states now is to have the pharmacy technician who is specially trained in that to take on that task. And again, that frees up time. And we found that both improves safety and the ability for the pharmacist to engage in other services. And so here's a diagram of what that really looks like. The figure there in front of you from a relatively recent publication in the Journal of the American Pharmacists Association. And what you see at the very top of that figure is the traditional model of pharmacy workflow, which is true for many countries. I don't know if it's the majority, but many countries across the globe, where the pharmacist is really the one engaged in delivering direct clinical care, as well as data entry and product verification. So both making sure that the right thing was entered, verifying that, and then also making sure that the right product was selected, kind of two different steps. The technician then is involved in data entry, telephone answering, and then the register, right? Checking that patient out. What we studied was something we call the optimizing care model, which really featured this idea of tech check tech, or technician product verification, where that verification of product step was taken away from the pharmacist and it was given to the pharmacy technician. What we found was an increase in direct clinical patient care delivered by the pharmacist because of time that was freed up. We also saw the pharmacist engage in new tasks, and that's represented by the additional little blue rectangles with little plus signs on the bottom of that figure. These new tasks for the pharmacist involved developing new clinical service offerings that were new to the organization or to the pharmacy, and developing new collaborative prescriber relationships. And it was all due to the fact that time was basically freed up. On the yellow, in the yellow rectangle on the very bottom of the figure, you'll see the technician really only took on one additional role. It was this product verification role, which involved, of course, as I mentioned, training and testing the knowledge and the skill set of the technician. But assuming those thresholds were met, having that technician engage in that service, and it made a large difference. Our hypothesis was really it was going to increase the amount of clinical service delivery, because it was really a function of freeing up time, this task delegation. But what we found was, in addition to that, it actually improved medication safety by reducing medication errors. I'll also share with you another study very quickly that we worked through where we did a triangulation to identify what are advanced roles for a pharmacy technician in high-performing MTM sites. I spoke a little bit about this already, but what you'll see on the screen in front of you is the comprehensive view of all of those skills put together. And why I like to share this table with the group is because when we look at this, there, at least in the studies we've done, there's not been a site that's involved the technician across all of these different roles, their technician teams. What this really is a compilation of several different sites and the advanced roles that those technicians were involved in. So what's neat to think about, to visualize, is what happens if you develop a pharmacy model where pharmacy technicians were doing all of these things consistently, right? Where you have just one pharmacy where the technician is scheduling patients, preparing a chart before the appointment, whatever that appointment might be, point of care testing, medication therapy management, vaccines, enrolling patients, documenting claim adjudication and billing, and then contacting physicians and patients. And then the rest of the tech team maybe also is involved in that telephone triage, admin responsibilities, and team leadership functions, really pulling other things, non-clinical duties away from the pharmacist. And then even involving these future responsibilities that in our studies that the pharmacists were sort of wishfully thinking a technician could do, but really could, including patient interviewing and obtaining medical and medication histories. What if there was a team that was doing that? And I'm sure there are many of you who are listening to this right now who either say, yeah, that's my practice site, or you know, I know of somebody who's in a practice site like that. And that's beautiful. I would encourage you to share that, engage with FIP, engage with your pharmacy associations in your local area, and spread that model. We are still working both in terms of regulatory approval across the 50 states here in the United States, and then also sort of socially to push this model. Because there's those two barriers, right? There's the regulatory permissive barrier, but even if you remove that, there's still this this social hurdle to come over for pharmacists who are used to doing many of these roles themselves, or may have a hard time giving up some of these roles because they enjoy them or they feel they do them better than somebody else. My argument against that would be, look, if you look at the previous slides, we said not only do we improve patient care, but we reduce medication errors. And so, you know, with this table here, if this was something that we were able to extrapolate, we were able to scale across most community pharmacies globally, what would be the impact in patient care? And can't we realign and refocus our training programs and you know, our student pharmacist and our student pharmacy technician training programs and educational models around something like this? I think the results would be incredible, not just for medication therapy management, but you could export this to other models of care and clinical programs that pharmacists are involved in. I think a really neat thing and something fun to imagine. And I think we are heading towards this, but what would be great is to put some structure around it to really be intentional about scaling a sustainable model of this type of pharmacy technician engagement. So as I conclude my remarks here, I just wanted to summarize with three basic bullet points. One is that advanced technician roles may hold the key to the advancement of pharmacy-based patient care. You know, certainly the signals would point that way. I would argue that most every study has pointed this way as well. Point number two, advanced roles improve patient care. They reduce medication errors, and they also improve the quality of work life. So three kind of distinct but very important measures of what a pharmacy is. And then lastly, pharmacy stakeholders should seek out opportunities to advocate for their advanced roles at various advocacy levels, including at the global level with FIP. And FIP has a wonderful and highly engaged and effective a diverse group of stakeholders involved in advancing pharmacy support staff and their roles globally. And so you could certainly participate in some of the work that we're doing there on the FIP level. But then also look at things happening locally within your city, or maybe even the next level up, and certainly at the country level, to figure out, how can you advance pharmacy technician roles where you are. I think what we've seen here in the States is there's a certain level of inertia because clinicians really like to hold on to the things that they've been doing well and for a while. And there's a skepticism about freeing up some of those things to other staff. But if you're able to sort of make a really logical argument with the evidence, which is out there, and there's a lot of it, and you do it in a consistent way over time, I think what you can do is you can win over stakeholders who are involved in, like I said, both the regulatory aspects within where you live and work, but then also sort of winning over the social perspective of the pharmacist, the overall pharmacist perspective of what is a pharmacy technician? What can that mean to my practice, to my patients, to my quality of work life? So with that, I'll conclude and invite anybody who wants to reach out to me with ideas for collaboration or just wants to chat about what's happening with pharmacy technicians where you live and work. Please reach out to me. I love to learn about what's happening across the globe. I certainly love to engage in collaborations around advanced pharmacy technician roles, particularly in the areas of medication therapy management and point of care testing. But we'd love to hear from you. And I just want to thank all of you again for the work that you all are doing in advancing pharmacy technician roles. And again, to thank FIP for the opportunity to present here today. So thanks so much.
Thank you so much, Ken, and thank you so much, Kimberly. I think those were so informative presentations that you made there, and you experienced just working with technicians and being able to provide that very, very useful, rich data from your work with technicians. I'm sure everybody is really benefiting immensely from these events. At this point in time, I want to introduce our next speaker. That's Pauline Roberts. Pauline Roberts is an MSc qualified systems thinking practitioner. She has over 20 years experience in systems thinking. She's also a visiting lecturer in applied systems thinking at Bayes Business School, City University, London. And she's also an associate lecturer on postgraduate system thinking courses at the Open University. Apart from that, she runs her own systems thinking consultancy business and has developed unique approaches to applying systems thinking called Creating the Conditions for Change. She's recently released a book about her experiences of applying systems thinking. The book is entitled Crossing the Bridge, A Practitioner's Learning Journey into Systems Thinking and Creating the Conditions for Change. Welcome, Pauline, and we really look forward to listening to you. Welcome.
Hi, everyone. Thanks for letting me join you today. I'm sorry I can't be with you in person. I really, really would have liked to have been, but I'm sure you're having a really great day. I'm going to talk to you about systems thinking, which is something you might have heard of, you might not have. It's become very popular, particularly in the last few years. And I'll share a little bit of that journey with you so you can see how it's starting to boom a little bit. So it is something you might have had some experience of already, but we'll see as we go through the presentation. If we're going to talk about systems thinking, we really have to ask ourselves, what are systems? So I'm going to mention that a little bit first at the beginning, and then what is systems thinking? What is it important? Why is it important? What can it offer you? As a pharmacy technician, why is it important to you? What can it bring to your practice that you don't do already? And I'm going to talk about taking a systems thinking informed approach. There are lots of approaches out there in systems thinking, lots of tools, and it can be really overwhelming. But actually, there are some day-to-day habits you can do as well that can mean that you're engaging in a systems thinking informed way. So it is accessible. And I'm going to talk to you about those so that you don't think it's this huge thing out there that you can't get close to, because there's something there that all of us can do that can take us into a systems thinking, informed approach to our work. But I'm going to tell you a little bit about the journey of systems thinking I've been on. I did start my working career as a pharmacy technician. I worked in pharmaceutical specials between 1998, 2004, and then I moved into medicines management in the NHS. I did leave the NHS around 2016 to start my own business, but those times were my formative years in my systems thinking, and they gave me some great experiences. But back then, when I was using systems thinking, you could Google it and you wouldn't find a thing on Google about systems thinking. Nobody was talking about it. Nobody was sharing anything about it. And it was quite academic. And that was part of the barrier to it, that it was stuck in a place where nobody was sharing their practice. And so nobody knew what it looked like. And therefore, it was difficult for them to adapt it in their working lives as well. And I came across this article, and it's an article from 2015, a journal article from an academic journal, the Journal of Health Policy and Management. And it said it's time to move from systems thinking talking to systems thinking action. And this paper commented on these constraints about applying systems thinking concepts in healthcare. And this was from a perspective of somewhere in Eastern Mediterranean countries. But I know in my practice back into 2015, it was still not being very talked about very much. Certainly, I was in the NHS at the time. I might talk about systems thinking and people would look at me like I was crazy because they did not know what I was talking about. So there have been language barriers in there and awareness barriers around systems thinking, but not anymore. Not anymore. It's really coming into its own at the moment. If you Google it nowadays, you get a different picture. There are a couple of studies here that are very readily available. I just Googled systems thinking pharmacy and up they came. One of them is about involving systems thinking and implementation science. And this was in a pharmacist's role at the time. It was 2020. And this was about facilitating safe and appropriate use of traditional and complementary medicines. And it was about delivering care in a really coordinated, systematic manner. There was another article as well that came up really readily, and it was about using systems thinking in patient safety. And this was about medicines management and about what led to unintended consequences, errors occurring over and over again, what was causing that, how could that be prevented? And that's something that we're always interested in, making sure that the errors don't happen in the first place. So 2017, 2020, we're starting to see some things coming through about the concepts and ideas of systems thinking. Started to get a bit more popular around about 2017 onwards. In 2023, another article, this is a fairly new one, and this was the effective improvement measures in reducing interruptions in a Japanese hospital pharmacy. So these are from all over the world. Everybody seems to be in fairly the same place in the way that they're picking up and using systems thinking. This was about workflow interruptions in pharmacies contributing to dispensing errors. Now we know how interruptions do cause errors. If somebody comes and barges in on what we're doing, it can be really distracting. It's a high priority issue, particularly for patient safety, and we all know that. But this article, this journal paper said this has rarely been studied from a systemic perspective. And I thought, actually, that's not right. Because I know I was doing lots of studies myself on workflow interruptions back in 1998 to 2004 in pharmaceutical specials. And we were looking at the situation systemically. We were picking out areas for intervention. We were making improvements. We were doing all kinds of work. So I think pharmacy technicians have been involved in systems thinking work for a long time. But maybe they haven't written it up. Maybe they haven't shared it. Maybe they haven't had the avenues to share it. So I think these things that are coming through as new, sometimes you may say to yourself, well, actually, we have been doing that for quite some time, and that's okay. I think it's just they're working their way through into the academic journals and things now. But what was interesting about this article was when it showed up from 2023, you know, very, very new, they are using a particular systems thinking tool. So they're using causal loop diagrams. And that's a formal tool. It comes from an approach called system dynamics. Very, very powerful tool. And I'll show you the diagrams in just a minute so you can have a look at what they look like. But what they do is help you map out a situation and the complexity in a situation so that you can identify points to intervene. It opens up different options of places to intervene to make an improvement in a situation. And that was coming through in 2023. So we are starting to see systems thinking emerging. And I just wanted to share this picture with you, give you a bit of a laugh, if nothing else. This was a group of pharmacy technicians that I used to work with back in 1998. When we were in pharmaceutical specials, that's the dispatch area of our laboratories where we're all crowded in, just having a bit of a laugh at the end of the day. Just wanted to show you that, yeah, I was there. And that was where I cut my teeth with systems thinking. That was where I learned my systems thinking craft. And it was a brilliant area because it's complex. There are lots of different things involved in the situation. So it's a perfect ground to try systems thinking out. But we need to ask ourselves, first of all, what is a system? So if I said to you now, what is a system? You might have things in your mind like an IT system, it might be a computer system, it might be an admin system, an accounting system, but you might also be thinking of an ecosystem, a forest, an ocean. And all of those things are right. Yes, they're systems. But in systems thinking, we categorize them differently. So there are things called hard systems, and these are systems that represent real world things. You can go out, you can touch them, you can manipulate them. You can improve an admin system, you can improve an IT system, you can manipulate it and improve it. But there's also another view of systems that we use in systems thinking. And that's that a system is not an actual thing that you go out and touch, but it's a concept, an idea that you use as a learning device to understand a complex situation in more detail. So there are different ways to categorize systems, and depending on how somebody categorizes system depends on how they practice their systems thinking and what they believe systems thinking to be. Nowadays, contemporary systems thinking is believed to be a way of thinking about situations by using the idea of a system to help us engage with those situations and understand the complexity in them. So it's a way of exposing things that help us learn about a situation. So it might be interconnections, interdependencies, different perspectives at play. It might be boundaries and value judgments. It might be the nature of the networks and the relationships. And we try and make those visible. We bring them out into the real world so we can see them and understand what their effect is on the situation. And that helps us to identify where we might get better leverage to make change. So applying systems thinking is about learning. It's about learning about complex situations. And this is a little quote from a book that I've just written. I say engaging with systems thinking is like getting a child's kaleidoscope and putting it up to your eyes. Because at first you just see a jumbled mess, lots of different nice brightly coloured bits of plastic, and it is just a jumbled mess of context. But actually with the right tools and techniques, you start to give it a little shake and a little twist, and you get a beautiful awe-inspiring pattern emerge before your eyes. And using systems thinking can be a little bit like that. That's what it's like. But why do we need it? We need it because generally we ignore interconnections. We assume people are to blame. Have you ever been blamed for something in the workplace and you know it's not your fault? Yeah, we're really good at that. We default to blame because it's easy. It's the easy option. We assume sometimes that there's one single cause of why something happens. And it rarely is just one single cause. It's usually a cascade of many. We focus heavily on what we can manage, and sometimes we focus too heavily on that, and we focus only on that, and sometimes we miss other things in the situation. And we keep taking the same kind of action over and over and over again. And sometimes it doesn't work for us, but we keep on doing it. So we need a different way of thinking about situations to help us get past this. We do this naturally just because we're human beings, so we can't get away from it. And we miss a lot of things in the situations that we look at just because we've become so accustomed to them that we no longer see them. So I'm going to do a little test now. I'm going to ask you, the minute I put the next slide on the screen, tell me what you see straight away in your mind. Tell me what it is you see. Don't think about it. Just think straight away. What's the first thing that you see? Let's go. What was it? Was it Nemo? Lots of people see little Nemo the fish first, mainly because they know who he is. They've seen him on the Disney films or whatever he's on. I haven't seen it myself, but I'm told he's a very happy character. So people see Nemo first. They might see the jellyfish. They might see the coral. Very rarely do we pick out the water. And yet it's the water that gives life. It's the water that's important. Because if the water isn't the right conditions, the other things are going to die. And we miss that. We become system blind. We don't see the water we're swimming around in every day. So systems thinking aims to expose that water to us. We've stopped seeing it. But so what? What does this mean for you? Yeah, it's a nice idea, but what about using it in the day-to-day? Well, can you remember that case study I told you at the beginning about the workflow interruptions in pharmacies? This is the diagram that they drew. Now, this is a causal loop diagram. It's a really powerful kind of systems diagram. It maps out the interrelationships in a situation, and they mapped out what was happening and identified loops of causes and effects. So not in a straight line, not one cause, not one effect, but lots of different causes and effects and how they link together. So how several of them linked together. What made errors occur when there were interruptions? And from this, they were really clearly able to identify where to make an intervention in this situation, how to make an improvement. Now, the study found that interruptions from things like a telephone call or having to go to the pharmacy counter, those kinds of things emerged from adaptive behaviour of both the pharmacy staff and the nurses to the conditions that they were working within. And they were working in constraints such as short staff, limited frequency of medication deliveries, lack of information about dispensing statuses. And so they were adapting their behaviour to those different conditions. And as a result, it was increasing the interruption and it was affecting the way that they were dealing with interruptions. And what they were able to do was identify some areas where they thought they could make an intervention because you could see it in the diagram. And they used that to identify what changes they could make. So systems thinking can offer you a different way to see a situation. It opens up different options to us because we see things differently. And there are lots of approaches out there, systems thinking approaches, and they all bring something different to the table. So some of the ones that we use, say in the Open University, we use system dynamics, which is the diagrams that you've just seen, and they expose things like interrelationships and interdependencies to us. We use something called a viable system model, and that shows us how we are managing complexity in a situation. We use something called strategic options development and analysis, or it's known as SODA, and that tells us about how we are pulling together different perspectives and how we make decisions from those different perspectives. We use something called soft systems methodology, And that's about when there's real ambiguous perspectives in the situation and we start to unearth those and work with those. What does it mean for our situation when people have got a different perspective of what is happening? And there's also something we use called critical systems heuristics, and that's about the value judgments that are being made in a situation. What are they? Why are they being made? What impact does that have on this situation? So it's more to us than just about improving a process. It's about the complexity and the decisions and the people, the perspectives, the value judgments. And it's about our structures as well, our structures and processes. So it's very wide ranging. And it's also about us. We can't forget that. It is absolutely about us because we're in every situation. And now those approaches might have looked a little daunting if you haven't had formal systems thinking training. They can seem a little bit out of reach. But there are things we can do every day that will help us to take a systems thinking informed approach. Now in 2018, the Australian Prevention Partnership Centre, they put out a lovely little poster that was system practices you can do every day. And I've adapted it and put my own pictures in here, but I really like what they had to say. And here are some easy things that you can do every single day. Stepping back from the details to see the bigger picture, exploring what really is influencing this situation that's in front of you. What else is going on here? And as you're doing that, being aware of your own frame of reference. How does how I'm thinking about the situation influence what it is I see? What beliefs and values inform how I engage and react to what is going on here? We need to see ourselves in the system. You know, we're in all of these complex situations. How do we engage? How do we contribute? How do we influence it? What's my impact on this situation? And there are diverse perspectives involved. Lots of people will look at exactly the same thing and believe it's something completely different. And it helps us if we can unearth that and start working with that and understand it. And we need to be present in the moment, don't we, and listen deeply, but we're not that good at it. We don't have big ears like that dog in the picture there. We can be really bad about it. What we do is we jump in, we just want a quick fix. We want the problem to go away. But we can easily step in and say, am I listening or am I just waiting to talk? Am I suspending judgment and criticism? Am I open to new information? Asking ourselves those questions can really stop us in the moment and help us to hear what's really happening. And we question our own assumptions. How do we know we're right? We reflect on our own thinking. And we try to uncover real unintended consequences before we commit to any decisions. What else might happen if we do with this? If we adapt this in such a way, what else might go wrong because of what we've done? And to help us do that, we use visual modeling, so diagrams. We put them out there to help us see a situation very, very differently. And sometimes they can help you see the water that you're swimming around in every day, the stuff that you miss. They are immensely powerful. System dynamic diagrams, particularly so. People in the NHS seem to like those. They understand them. They can see the situation in front of them when they see those diagrams. So we're looking for connections and interrelationships. We're looking to gain new insights. Which parts are connected? What's the relationship? Where's that relationship taking them? Is it somewhere we want them to go? Or is it something that we don't want to happen? What's happening regularly? What's reoccurring? And because we're people, we need to reflect regularly. And, you know, we look at situations, it might be one way today, it might be another way tomorrow. What deep learning can we get? What actually happened? What does it tell me about the system overall? And can I work with this new insight? Stepping in and asking ourselves questions like that are some of the first steps to putting in place systems thinking. And you might have heard of this phrase, systems convening. It's become really popular just recently. It's been pushed as a really new phrase in the NHS, and yet this behaviour has been going on for a long, long time. Lots of people have been systems conveners for a long time. We open up spaces for new kinds of conversation. We work across boundaries. We spot opportunities for learning. We bring different people together, and we use our own legitimacy to engage in learning. All of those things are elements of systems convening. And we also create the conditions for real critical social learning. We learn together, not just on our own. And that's another element of systems thinking that we bring in. We bring in an understanding of that. We have a sense of coherence and integrity. We think about purpose. We think about our own experiences, and we think about being critically aware. And what is going on for us at the time? What's our emotional ambience as we're engaging with these situations? What are our relationships with regards to power? Are we trying to maintain power in a situation? Are we trying to protect ourselves? Have we got enough power to do what we need to do? Do we have to engage somebody else? So we really critique all of these elements in a situation. It isn't just about improving a process. It's a little bit further than that. It's about being a systems thinker. It's definitely about considering interrelationships, perspectives, boundaries, different value judgments. It's about engaging with a situation and contextualizing, using a tool or approach that really makes that context visible. It makes us see the water we swim around in. And we have to manage our own interaction with the situation. How do we learn? How can we be reflective? Can we think critically? Those things are absolutely vital in our systems thinking. So that was a bit of a whistle-stop tour about systems thinking. I hope there's something there that's really sparked some interest for you. I do have my contact details on the slides here. If anybody wants to contact me because you've got queries or questions about anything, please do feel free. You can talk to me at any time. I am quite friendly. And there's also a book about my journey into systems thinking, if anybody's interested in that. Just wanted to let you know that that is available. But thank you very much for listening, and I hope you have a really great rest of your day. Thanks, everybody.
Thank you so much, Pauline, for that presentation. That was so inspiring, and I'm sure a lot of people have picked up something around systems thinking that they'll be able to apply, not only at their workplaces, but I think this is something that would apply in very many situations, even just life situations. I want to encourage everyone to send in their questions if they have any through the Q&A. I know there are a few inquiries that have already been made and answered. But if you have any other questions, you can send that through the Q&A tab. And at present, yeah, I think there's, okay, so I've just picked up one question there from, do you have any tips for, so a question for Kim, do you have any tips for attendees who are interested in getting started with research?
Yeah, thank you. Thank you, Ryan Burr, for the question about that. So I do quite a fair amount of pharmacy practice research, and it can be a bit daunting sometimes for folks to get involved in that. Maybe they have a great idea of something they'd like to research or something that they're doing that they think could be quite impactful. So I guess my advice around getting started on that would be to try to connect with existing researchers in your area of interest. So maybe that means seeing what's out there in the literature on that topic and connecting with those who are already in that zone. You know, I find a lot of us in academia, we really love to collaborate. And I'm sure for Dean Michael, I'm sure it's the same, you know, with your school too. We like to work together. We like to do new projects. So if anyone out there is interested in getting going on, practice research, particularly in the technician space, I think connect with those around you or those internationally who are working in the same area that you're interested in.
Thank you so much, Kim, for that. And yes, just to encourage everyone, I think research is so important and can be very interesting. Yeah, I don't see any other questions. Let me see. I think there's one. Okay, so this is an anonymous, and I think it's quite contextual. So in Kenya, we're seeing the regulator recommend for maturity level 3 as per WHO. What is the fate of technologists in the context of immunization? I probably just want to, I could answer that. I think this is an ongoing conversation. There's a lot that is happening in our space, and we would have to wait until some of those legislative processes are completed for us to have a very good answer. So I want to just hand over this to Kim to maybe take us through the closing session. And again, I really appreciate everyone who was able to attend. Kim, over to you.
Thank you. And thank you again for the opportunity to be here. I love working with the FIP group. Just it's wonderful to be able to connect with people all over the world. It's fabulous. So thank you for attending our presentation today. I'm going to go ahead and put my email address in the chat as well. So if anyone thinks of additional questions they'd like to send my way, please feel free to do that. And I truly believe Ken and Pauline would be thrilled if you reached out to them with questions as well. So with that, thank you for attending. There's a note on the slide there about checking out. There's future digital events. I believe they offer them quite regularly. And so here's the website there if you'd like to check that out. And then the next session is going to be starting shortly. There's a whole nother portion to this presentation. So please stick around with us and give us a moment or two to transition the slide deck. But thank you. Thank you again for being with us. And I look forward to seeing the next set of presentations.
Hello, everybody. I hope you can hear me. Can someone just put a thumbs up and let me know? Yeah, I can see Tara shaking her head. Thank you. My name's Alison Hemsworth. I'm going to be chairing and moderating your session. Well, it's afternoon here in the UK. I have no idea what time it is elsewhere in the world, but it's certainly a nice sunny afternoon here in the UK. So welcome to the second half of this Global Pharma Solutions Symposium today. Can we move on to the next slide, please, Ryan? So this information on this slide is a little bit about me. So I am a UK pharmacy technician and I'm registered with the General Pharmaceutical Council. It's mandatory to be registered to work as a pharmacy technician in the UK. I've worked in all sorts of different sectors, but probably the highlight of my career was when I worked for the National Commissioning Agency, and I led on many high-profile national projects and policy developments. And I am responsible for the introduction of the community pharmacy seasonal flu vaccination service in England, which is I'm very proud of. This next bit of information about me is actually literally just out of date. So I no longer work for Community Pharmacy West Yorkshire because in the last 3 weeks, I've just taken on a full-time PhD at the University of Huddersfield. So that's a really exciting development for me. So whoever asked the question in the last session about how to get started with research, more than happy to help with that if you would like me to. Next slide, please. So just a reminder that this webinar is being recorded and live streamed via YouTube. If you are unable to stay for the entirety of this session and would like to watch it back later, or even if you just want to go back and refresh your memory, and you can access the recording at the link that's on that second bullet point there on this slide. As in the previous session, you can ask questions as we go along. If you can pop them into the chat bar, and I will moderate as we go along and fill them to the right person. So if your questions for a specific person, whether it's Tara or Michelle, if you can just put in your question, this question's for Tara, this question's for Michelle, that would be really helpful. If you have any feedback on this part of the session, then please feel free to send that to the webinars at fip.org. And all pharmacy professionals are welcome to become members of FIP, again, using that link there at the bottom. Thank you, Ryan. So, in a moment, I'm going to introduce Tara to you. Broadly speaking, we're talking about pharmacy partnerships this afternoon. So Tara's got one presentation and Michelle's got a second presentation. And we're looking at how pharmacy technicians can be and are incorporated into the medication administration process in a national paediatric cancer service. I think that's Michelle's presentation, and an implementation study. And then obviously there will be chances for you to ask questions at the end of the session. Next slide, please, Ryan. So here's the learning objectives for this afternoon session. So to be able to describe the executive management opportunities for pharmacy technicians. I love that phrase, executive management. We've waited a long time as pharmacy technicians for us to see that on slide. So whoever wrote that one, thank you. To identify ways to collaborate with colleagues across organisations, and I'd like to add across the world, and understand how innovative new practice models in which pharmacy technicians are decentralised throughout a hospital system. Next slide, please, Ryan. So I'll now introduce you to our first speaker, which is Tara Clayson-Fisher. Tara and I have fairly recently met virtually, but not yet in person, but watch this space, Tara. She's worked in pharmacy practice for 15 years and is a strong advocate for the pharmacy technician workforce, clinical excellence and patient care. And clearly those three things go very well together. Tara lives and works in Tasmania in Australia and is a statewide pharmacy technician manager for the Public Hospital Pharmacy Service. It's a unique position that's embedded the pharmacy technician voice at the executive level and provides oversight to the strategic growth and development of this workforce across 4 hospital locations. Next slide, please. Okay, Tara, over to you when you're ready.
Lovely. Thank you so much for the introduction and for the invitation to be here today. It is 11:30 p.m, so I have a cup of tea instead of a glass of water. So you can pop over to the next slide. Thank you, Ryan, but thank you so much for having me. Firstly, I'd like to acknowledge, in the spirit of reconciliation, I'd like to acknowledge the traditional custodians of country here in Australia. I have the absolute privilege to live and work on the lands of the Tasmanian Aboriginal people. I live in Hobart or Nipaluna, which is the land of the Murri-Winner people, and I would like to acknowledge the deep connections to land, sea and country that they they have, and to community. And I'd like to pay my respects to elders past and present, and to any other First Nations people joining us here today. So thank you for that. Ryan, next slide, please. So learning objectives, I get this one, which is really exciting. So to describe some of the executive management opportunities for pharmacy technicians, and I probably should have included the connecting across different organisations as well, because it flows into that quite well. But thank you. So firstly, for a little bit of context around pharmacy technicians in Australia, obviously we have a really diverse group here tonight, so I'd like to make sure that everyone understands where I'm coming from, and I'm not assuming too many things of people's knowledge. So you may hear when you're talking to Australians, people saying pharmacy assistants and technicians. Those words are somewhat interchangeable in Australia. It can vary from state to state. And here, unfortunately, not at this stage, our pharmacy technicians are not considered a registered health profession, and are not really a recognised health professional workforce. While we do have vocational qualifications available for pharmacy technicians, they are adopted quite variably for use across different organisations. In community pharmacy, it is a lot more well adopted and well embedded within their organisations' training. And so the community pharmacy qualifications, however, do sit under the retail qualification rather than a health qualification. The activities covered in those qualifications are really around dispensing and stock management, which includes inventory management and ordering. And a lot of education is provided for pharmacy technicians in that space around different ailments and providing over-the-counter or non-pharmacist required treatments. And that can be for things like minor wound care or GI upset, hay fever, those sorts of things. And they're provided really structured training around when the right point to escalate to a pharmacist is in those settings. They're also provided with a lot of training around sales knowledge, particularly around vitamins or complementary supporting products. And in Australia, we have access to what's called the PBS, or the Pharmaceutical Benefits Scheme, which is a government-funded program for discounted medicines for patients, and that comes with quite a lot of claiming processes, so a lot of training around that, because the technicians are heavily involved in managing those processes. In the hospital pharmacy setting where I work, so the training is quite similar. It's still a vocational qualification. And over the last 18 months, it's undergone quite a significant revision. And we're just starting to see the new version of that qualification available at the moment. Again, it includes a lot of those dispensing activities, but in the hospital setting, that includes for inpatients as well as outpatients and discharges. Lots of stock management and as well, and it also extends into the sterile and non-sterile compounding roles, and that PBS activities in there as well. Across our country, so we have multiple different states in our country, and each of those have different requirements for employment, and the different EBAs or enterprise bargaining agreements that different hospitals work under do have various requirements built in for pharmacy technicians around qualifications, and it does vary quite significantly between state to state and even between hospital to hospital in some settings, and so that does make challenging and standardisation of training across our country quite difficult. I'll pop to the next slide. So as Alison mentioned, I've worked in hospital pharmacy for, I mustn't have added that up right, 16 years, I think it is at the moment. And I've been in hospital pharmacy for about 11 of those years. And traditionally, pharmacy technician roles have been very dispensary or manufacturing and supply based, where the tasks are highly repetitive and require a high level of accuracy with a very low tolerance for error. But over the last, 10 years, we've started to see roles emerging that have a lot more autonomy and responsibility, and therefore also require a lot of additional training as well. This tends to be, so in my setting, so we're looking at the Tech Check Tech program, so pharmacy technicians checking and releasing medicines, and also clinical activities, which is my specialist area. So, and that is training pharmacy technicians to do best possible medication histories and discharge to support as well. There's been a lot of work from the Society of Hospital Pharmacists trying to gather information about what our pharmacy technician workforce in Australia has been doing. And in 2016, they published a big white paper around the current experiences and expectations of the technician workforce. And a good colleague who works in Melbourne, Brett, is currently completing his PhD at the moment, redoing that workforce survey to see what's changed in that time period. Obviously, we had a small pandemic thrown in the middle of there as well, so there have been some forced changes, but also some unexpected changes as well, and some delays perhaps to the progress that we would have expected in between. With this change in role opportunities, it does require a significant cultural shift from pharmacy technicians ourselves, and also from pharmacists. And particularly for the technician workforce, that tends to be around education expectations. So traditionally, you would just come to work, do your work and get it done and go home. And that might be the end of all you think about for your workplace. But over time, we've started to expect that people participate in education, both informally and formally at work. And sometimes that can be in their own time as well. And it can occasionally be at a cost to the pharmacy technician themselves. So this expectation that you will complete the training program, but it might not be fully funded by your workplace is quite a significant shift. And we also, not everyone wants to change what they're doing, especially if they've been in those roles for a long time. So we need people to want to move into these roles if we're going to be creating new roles. It also requires, as one of the previous speakers mentioned, a shift in expectation from the pharmacist workforce as well. So there's a requirement for trust and delegation of activities to pharmacy technicians, and a real shift from what used to be quite a hierarchical relationship into quite more of a partnership between the pharmacists and the pharmacy technicians, which is a shift in context as well. Next slide, please. So, as I mentioned, I live and work in Tasmania. I should have included some photos because Tasmania is truly one of the most beautiful places in Australia. I hope there aren't any South Australians on the line because I only moved here 12 months ago, and I think they'd be a bit cranky at me for saying that. But Tasmania is one of the most stunning places in the world. Todd Babiak, who is the lead for Brand Tasmania, he has called it a place where ambitious introverts who love nature can thrive. And I think that's such a beautiful way of explaining our state. And I'm really pleased to be here. As you can see from our map, it's an island and it's considered a regional area. We have a population of about 550,000 and close to 50% of that population live in the southern region of Tasmania, quite near that little red dot at the bottom of the island there. So in Hobart, where I am, creating quite a significant challenges across the state for medication supply specifically. Statewide hospital pharmacy where I work. So we provide hospital pharmacy services to all of the public hospitals in Tasmania, and we have staff on site at the 4 major hospitals in Tasmania. So we have the Royal Hobart Hospital in the south, and then we have 3 smaller medium-sized hospitals in the north and northwest as well. Statewide hospital pharmacy have about 350 full-time equivalent staff spread across those sites, and approximately 34-35% of them are pharmacy technicians, and that technician workforce is growing quite significantly, quite quickly. Next slide, please. So prior to my role existing, so statewide hospital pharmacy, our executive director, some of you might have seen Tom Simpson at some of the, if you were at the FIT Congress. So he is also the president of the Society of Hospital Pharmacists of Australia, and he's the executive director of our organisation. And underneath him, we have what's called a matrix organisational model, that's organisational structure. where we have our operational leads, which are on the left-hand side of the slide, and they are responsible for all the pharmacy services within a hospital. And then we also have what are called portfolio leads, and we have one for cancer and compounding, clinical pharmacy, which includes our pharmacist education portfolio, our dispensing work area, and we have a multidisciplinary medication safety team that includes pharmacists and also nursing staff. And we have an operations and medication supply manager. The operations and medication supply manager is the only non-pharmacist on that executive management team. And really this team's where all of our long-term decisions are made, for which impact the whole of our workforce. And I can say hand on heart, this is a truly excellent team and a really thoughtful team. But they're often people who interact with pharmacists who are managers, but not necessarily with the technician workforce. So there was a bit of a gap in the way that people were interacting together. Next slide, thank you. Sorry, I appear to be losing my voice for some reason, so I do apologise. So our pharmacy technician roles in Tasmania in early 2021, so the broad majority of our workforce are a rotational pharmacy workforce, and they mostly participate in those dispensing and distribution activities, so inpatients and individual medication supply. We had a fledgling project, the bedside medication management project, which was moving some of that medication supply function out onto the ward. So pharmacy technicians responsible for ordering medicines instead of our nursing staff doing that, which was how that was operating before. And then we have our outpatient and discharge pharmacy. James is going to be annoyed with me because I put compounding under dispensing and he'll be very upset, but we have our compounding and manufacturing service, which is a really significant service for us. And then we also have our medication supply and ordering team. As an island state, we have some very unique challenges in medications access. It's not a very large piece of water in between us, but there are often very high winds and seas, so medication supply can be a lot more challenging for us. And because we are relatively small, well, we are one of the smallest states in the country, there's additional challenges there as well. So that team's really vital to our services. And then we have a small number of lead pharmacy technicians as well, who are pharmacy technicians working at a slightly higher classification, and they're responsible for managing our pharmacy technician workforce at that site level. Predominantly, they're involved in rostering and daily coordination activities, but functionally, they tend to spend about 90% of their time being operational and being really hands-on and like doing the work, and it's been quite necessary for them to do the work historically. Next slide, please. So my role as statewide pharmacy technician manager didn't just appear out of thin air overnight, unfortunately. A lot of things had to happen for us to get to a point and to where this position was really clearly identified and articulated and well supported by the team as well. So we had a statewide hospital pharmacy operational strategy that went from 2018 to 2021. And in that strategy, we had identified workforce development as a key element of our plan and a really key requirement. And we'd clearly outlined that the workforce plan needed to think about our pharmacy technician workforce and to clearly articulate a career pathway for that workforce. And ensure that our pharmacy technicians had both the capacity and the capability to operate at their full scope of practice. From this, the pharmacy technician workforce strategy and roadmap was born, and it was a huge piece of work that initially started with extensive research, both at the national and international level, to understand what the current roles, what potential current roles there were out there, and what expanded scope roles may be of relevance to our setting. And as a number of people have already mentioned, there's so much evidence that shows that strengthening and advocating for the role of pharmacy technicians builds the capacity and efficiency and also the effectiveness of the pharmacy workforce as a whole. So it was really seen as essential from that evidentiary perspective. We also looked at the different workforce agreements around the country and how they compared to Tasmania, and consulted with a number of colleagues across different Australian hospitals that had already made progress on their career development pathways. It's funny, now being in this role, I was consulted as part of that. So it's a nice little marry up to see how it all ended up. And then the second part of that, of developing that strategy, was some really quite significant and intensive interviewing with our workforce. So we had a external consultant group come and interview our pharmacy technicians independently. So we didn't have any pharmacists in the room during those interviews, so that the technicians, or any managers, so there was no one that they reported through to, so that they had the opportunity to speak really freely. If we're creating a workforce strategy and roadmap for them, they need to want it, and it needs to be reflective of their experiences. And so they also had opportunities to meet one-on-one with the consultants, or to provide feedback through a number of different means, so that we could make sure that we gathered as much information as possible. We married those things together. And then that the draft strategy and roadmap was presented back to the pharmacy technician workforce for their feedback again before it was finalised. And then in early 2022, we got HR sign off to go live with the first stages of that roadmap. Next slide, please. So we came up with a clear vision for our pharmacy technician workforce, and that was to create a dynamic, confident and responsive pharmacy technician workforce who are equipped by continuous knowledge, skill and competence development, and are supported by expert leaders to provide high quality, team-based collaborative care for the ultimate benefit of our patients. Thank you. Next slide, please. So there's three key strategies to this workforce plan, and the majority of this came directly from feedback and from themes that we got out of that feedback. The first strategy is really around establishing that foundation of practice, and so developing our pharmacy technician competency framework that underpins the role definitions, and making sure that people understand the role that they're meant to be performing was absolutely key to that. And there's a number of key pieces of work that are coming out of this around orientation and general rotation training. And we've done quite a lot of work to update our orientation packages for staff, so that we are providing structured, relevant and accurate information to teams so that they can do their work well. We identified that there was a number of inconsistencies based on who did your training, or where you did your training, or at what time you came into our organisation, that you received a slightly different experience, and there was definitely areas for us to improve. As our organisation has also gotten quite a lot larger quite quickly, it became evident that maintaining skills in all of the distinct roles has become quite challenging. And so for one of our sites, we have more than 45 different roles that anyone could be rostered to on any single day. And if you were to rotate through every single one of those roles, it's just not reasonable to think that you would remember how to do role number one by the time you get all the way through the other 44 roles and back to that one. So we're looking at cell group rostering to maintain that competence and efficiency across the different rotational areas. Next slide. The second strategy is to facilitate growth, development and recognition of our workforce. And it was absolutely clear from feedback that there weren't adequate opportunities for personal and professional development for our technician workforce. And we probably didn't even need people to tell us that. If you looked at our organisational charts, there were very, very few opportunities for technicians to progress in their careers. We did have a small number of leadership positions, but they were generally really tightly held. And so one of our sites had only hadn't had a vacancy in that leadership role for close to a decade. So all of the staff there had not been able to have a single progression opportunity for such a long time. And that's problematic for multiple reasons, but firstly, because it obviously limits the growth and opportunity for those staff members. But secondly, because when those opportunities do present themselves and you're given one chance to progress your career in a whole decade, that becomes really emotionally charged and stressful for the whole team. And it's actually quite destructive to team morale when that position is recruited to. And so it was creating all sorts of challenges because of that. So we have a number of really clear goals and plans to change employment conditions and to negotiate with our organisation to change the way we employ pharmacy technicians, and that's we're creating a technician workforce career pathway that goes right from that trainee phase through to the advanced scope phase, with options to go into leadership roles and making sure we've got advancement opportunities that aren't reliant on being in a leadership position as well. Our trainee roles include access to the vocational qualifications, and we've actually extended that access to our pre-existing staff because not all staff had previously had the opportunity to complete those qualifications either. And we didn't have many opportunities for people with different experiences to join us. So traditionally we were recruiting from other hospitals, from the mainland or from community pharmacy. And so we had a really small pool of potential people that could come into our organisation. And the other thing we're doing is developing advanced scope roles, so particularly in clinical and dispensary areas around those dispensing, checking activities, and also those best possible medication history type activities. Next slide, please. The third strategy is finally where I come into it, I guess. And so historically everywhere, I think, especially in Australia, a lot of the work that's responsible for advancing pharmacy technician practice has been done off of the side of people's desks. And so it's generally been a really enthusiastic and passionate pharmacy technician who wants to do more, and a really supportive pharmacist working together to achieve something and to put a new process in place. Those people are generally great people. They deserve promotions and they get promotions. And then that passion project falls over because there's not a structure in place to support it. And so this particular strategy is really around creating that structure. And so the statewide pharmacy technician manager position was created, and a portfolio to manage that technician workforce development as well. And the goal of the role is to really drive collaboration, consistency and improvement initiatives across the whole state for our pharmacy technicians, and to represent our technician workforce at that executive level. The other part of this particular strategy is around supporting those lead pharmacy technicians. And so it was really clear that our lead pharmacy technicians weren't necessarily clear on what their expectations were, and their managers had different expectations to what they did. And so making sure that they're provided with leadership training, which we've done a number of courses with them on, to provide them with the tools and the skills to be able to perform their jobs well as well. It's exciting, and we're starting to see some real changes in that. So at that point, our lead pharmacy technicians were really spending 90% of their time working operationally, which meant they didn't have that time to develop the teams that they're responsible for as well. Thank you. Next slide, please. So our organisational chart has changed. So there's an additional stream in that portfolio lead now. So the statewide pharmacy technician manager position, and that's a peer level position equivalent to a director of pharmacy, and equivalent to those portfolio leads as well. It is slightly unusual when compared with the other portfolio leads because it's responsible for a whole workforce that interacts with all of those different portfolios and all of those operational leads. So I'm a little bit everywhere all of the time. Next slide. So obviously this was a huge piece of work, and to get an idea and a piece of work like that to reality and to being every day does require something special. We were really fortunate that in late 2021 we received approval for statewide implementation of that bedside medication management project, and so that saw an additional 30 full-time equivalent pharmacy technicians recruited across the state, which was an absolutely huge project for us. And many of the staff who were employed during those positions were employed through that trainee pathway. And we've been able to rotate those staff out into ward-based positions to facilitate more timely supply to medication. So the nursing staff historically were responsible for ordering those medicines, but that task has now been allocated to our pharmacy technician workforce. A huge shout out to Katie Ambrose, who she acted as the statewide pharmacy technician manager and project lead for the implementation of the bedside medication management project. And that this project really facilitated quite enough to jumpstart a number of things from the roadmap, particularly around the orientation and around the competency framework for the pharmacy technicians. Next slide, please. I came in late 2022. I was appointed to the role of statewide pharmacy technician manager, and at that point the role began to shift from that bedside medication management project focus through to a more strategic leadership focus, and fortunately was able to do this because Katie did such an excellent job of implementing that project. The role is now responsible for providing high-level leadership to the pharmacy technicians across the whole state. I work collaboratively with the directors of pharmacy to support implementation of statewide practice changes across all of the different sites, and work with the lead pharmacy technicians and their line managers to bring more clarity and consistency around their roles as well. I'm a core member of the statewide executive committee, and I represent statewide hospital pharmacy, not only within our pharmacy walls, but across to other departments and nationally as well. This strategy and roadmap is basically Tara's to-do list now. Next slide, please. So working in partnership with my colleagues from the executive leadership team, we've been able to achieve quite a lot. It was nice to put this together and to realise that. So we have our clinical advanced pharmacy technician pilot project, which we're running as a multi-site pilot project for the advanced pharmacy technicians working out on the wards, performing best possible medication histories of discharge facilitation. We're scoping at the moment for a dispensary-based advanced pharmacy technician pilot project, looking at that tech activity. And we're also looking, like many places, virtual care is becoming our new next thing, and we're looking at opportunities to use pharmacy technicians in those spaces as well. Our lead technician workforce, they're the technicians that I spend a lot of time with, or most of my time with. And so generally across the whole state, we've seen a real uplift in the amount of time that they're spending in site management and portfolio management meetings. So they're becoming a lot more involved and engaged in our service planning, and making sure that when we are making decisions that we're considering that technician perspective as well, and improve partnerships with the peer pharmacists that they have across our organisation. Next slide, thank you. This slide's a little bit messy, and I do apologise for that, but I think I like to look at it even though it's messy, because I think it shows how much things have changed in the last 12 to 18 months. So all of those blue roles are new opportunities that we have for our pharmacy technician workforce. The ones in italics are not very far away, they're just not quite here yet. And so we have those trainee pathways now available to our workforce. The bedside medication management is a statewide standardised role that we have at all of our sites. We have our advanced pharmacy technician pilot project for the clinical in progress. So we have 5 staff going into those roles, with 3 of them starting next Monday, which is very exciting. And then we also have our tech in scoping. And again, to make sure we've got the structure to keep this moving forward, we're looking at implementing technician educator positions, which are quite unusual in Australia. We don't have many roles like that nationally, but it's absolutely vital to make sure that this keeps progressing and that it's not a once and done kind of event. Next slide, thank you. So working in partnership not only has been at that site level, but it's become nationally as well. And so last year I was invited in my capacity as the statewide technician manager to speak at our national conference around scope of practice it was a conversation around pharmacist and technician scope of practice. But like we've mentioned already tonight, we can't expand that pharmacist scope of practice unless we also expand our pharmacy technician scope of practice. But those opportunities to present at those sorts of events probably wouldn't have occurred in the same way if it weren't for this position. And then not long after that, I was invited to the Directors of Pharmacy Forum, which is an invite-only forum that directors of pharmacy from around the country attend. Again, it was looking at pharmacist workforce challenges, but there's been a real shift in the way people are thinking about that and thinking about how we do things. And I also am one of the members of the state SHPA Technician and Assistant Leadership Committee. Next slide, thank you. So yesterday was Pharmacy Technician Day here in Australia, and I think there's been a real shift. I've been in hospital pharmacy now for quite a while. I've been in pharmacy generally for a little bit longer than that, and it really feels quite different at the moment. So yesterday we had a number of announcements with Pharmacy Technician Day, and our theme here in Australia was choice, leadership and recognition. The Society of Hospital Pharmacists Australia made 2 quite significant announcements for our profession yesterday in regards to this. So recently the SHPA partnered with the New Zealand Hospital Pharmacy Association to establish the Australian and New Zealand College of Advanced Pharmacy. And that college is about building recognition pathways for our pharmacists, or for our whole workforce, but at the moment for our pharmacist workforce, so that they can go through that residency, registrar, consultant phasing and be recognised for their expertise across more than 40 disciplines of pharmacy. The program was only launched last month, and SHPA have put together a working group to look at what the technician version of that will be. So they've been really on the forefront of including technicians in that and making sure that there's opportunities to build plans into that for that, which is really exciting. And so generally in Australia, there's no real formal recognition of the role of pharmacy technicians and the role that they play in improving patient care. And to be looking at the future and a program that recognises that, but also potentially recognises that technicians have specialty areas of practice is quite momentous for us. The other exciting announcement, it feels a bit weird to speak about, so the Society of Hospital Pharmacists is the only current Australian pharmacy member organisation that allows pharmacy technicians to be full voting members with full rights, and building on that, they're paving the way towards a change for their constitution to include a pharmacy technician member on their board of directors. In the interim, a temporary observer position has been established for the next 12 months to ensure that that technician voice is at the table as soon as possible. And I'm incredibly grateful that I've been appointed to that position, which is really exciting. And I hope that I can do well in that position and convince them that they've made a good decision. But I think what's really exciting for me, regardless of what happens with my tenure in that position, is it's what it represents for us as a profession, and for a profession that I truly love, to be acknowledged as having an important part in planning the future of our workforce and of our organisations, is absolutely just exciting to me. I could talk about that all day. So I think I'm a bit biased, but I think both of these changes are absolutely exciting, and I'm really looking forward to what 2024 has to bring in this space. Next slide. So that's, to me, what's most important is looking to the future and how do we keep this momentum up and how do we make it sustainable. This statewide pharmacy technician position didn't come up overnight in Tasmania. There were a lot of things that got it to a point where it could happen. But I think what's really important is to make sure, if you're a pharmacy technician who's doing something really cool, or if you're a pharmacist or a pharmacy manager, and you're not sure that a pharmacy technician could do something, or you've seen one pharmacy technician do something, step back and think about it, and don't pull the ladder up behind you. Let's spend some time wondering if it's a technical or project-based or leadership activity, and is it something that can be delegated to a pharmacy technician. Ask them if they'd like to be involved in it, and give them the time and opportunities to build those skills. I learned how to contribute effectively because I was given opportunities to contribute effectively. I know how to write formal meeting papers and budget briefings and all those sorts of things because I was given the opportunity to do them, and I was mentored and given feedback so that I could do them well. So creating time for that's absolutely important. Investing in our workforce is absolutely essential, and I think we've done a really good job of recognising that our pharmacist workforce require ongoing education in their work. In Australia, it's in order to maintain their registration, it's a requirement, and so we're really clear that that education doesn't stop once they become a pharmacist. Particularly around having those embedded pharmacist educators within our workforce as well. And so the other thing that I think is important is recognising the excellence that already exists. I can't tell you how many pharmacy technicians I know who are no longer pharmacy technicians because they found other opportunities elsewhere and they ran out of opportunities within their workplace. So making sure that we're recognising, acknowledging and rewarding that expertise and excellence when we do find it. Next slide, thank you. So establishing an executive level technician position has delivered for our statewide hospital pharmacy organisation, it's delivered better strategic planning and more robust discussion and problem solving by expanding the full breadth of our pharmacy workforce. But it's had an impact on the way that we do things across all sorts of different organisations. I know of at least 2 different organisations that are looking at similar roles based off of my role. One of them's come to visit us, hung out with us, had a look at my role description, talk to us. And so having opportunities and sharing opportunities and what you're doing is absolutely important. But it's like we've said a number of times today, advancing our pharmacy technician workforce is essential if we want to advance our pharmacist workforce. It's essential if we want to advance our medical workforce. Healthcare is a team sport. And I think that's what's the most important takeaway from this. I apologise because I've gone way over time, I'm sure, but I could talk about pharmacy technicians and providing opportunities to pharmacy technicians all day. I would absolutely like to acknowledge Tom Simpson. He's my boss and an excellent friend, and I couldn't enjoy working with him more, as well as Camille Boland, Chris, James, Lisa, Ed, Kelly, Sarah and Katie, who was in the role prior to me coming on board. And that's all from me. Thank you.
Thank you, Tara. That was an excellent presentation. I think we're going to take questions at the end, if that's okay with you. I can see there's lots of people doing some virtual hand claps, so well done. So we're going to move on now to Michelle Byrne, who's our next speaker. Michelle's a senior pharmacist at the Children's Health Island in Crumlin in Ireland. Michelle works primarily as a specialist clinical pharmacist on the haematology and oncology inpatient ward, and she's previously worked as an aseptics pharmacist and a clinical trials pharmacist at the same hospital and also at Beaumont Hospital. Michelle has completed a postgraduate diploma in clinical pharmacy and recently a research master's with the RCSI, evaluating the introduction of pharmacy technicians into the medication administration process in an Irish paediatric hospital. So Michelle, if you're ready, it's over to you.
Thank you, Alison. Thank you for the introduction. I'd also like to thank the organisers for the opportunity to speak this afternoon, and good afternoon to everybody from a very rainy Dublin. As Alison said, I recently completed a research master's, which was an implementation study on the incorporation of pharmacy technicians into the medication administration process in a national paediatric cancer inpatient service. Next slide, please. So just a little bit of background, firstly on my very local setting, which was the hospital I was working in, which was a public hospital, a paediatric specific hospital. It contained the National Paediatric Hem-Onc Centre, which had 19 inpatient and 4 transplant beds, and that was the location of where we set up this service initially. All prescribing and administration of medications is done on an individual patient paper-based medication chart, so we're not e-prescribing yet, and all medications, IV and oral, that were prepared and administered to patients were independently double-checked by 2 nursing staff members, and they followed the 10 rights of medication administration. Next slide, please. On a broader sense, just a bit of background about pharmacy technicians in Ireland. So they are currently an unregistered profession with no regulation from a governing body. There is definitely an appetite for change amongst pharmacy technicians and pharmacy staff in Ireland, and advancing pharmacy technician roles is very much so in its infancy in Ireland. I was very interested and heartened by Tara's presentation to see that the tide can change, and I'm hopeful that there definitely are exciting times ahead in the pharmacy technician workforce in Ireland. But currently the status is that they are unregistered or uncertified. They are largely employed in community pharmacy and hospital-based dispensaries. And currently in my hospital, there are 17 pharmacy technicians employed, and they mainly work across very traditional pharmacy technician roles, such as procurement, reimbursements, procedures, drug distribution within the hospital, outpatient medication dispensing, and extemporaneous and aseptic compounding. Next slide, please. So the background to this study, which started in October 2019, where we employed 2 pharmacy technicians to provide the technical checks on the preparation and administration of IV medications only. The clinical checks remain the responsibility of the nurse, so medication prescribed for the right reason and suitability were still remained with the nurse. The pharmacy technicians were working 8 to 4, Monday to Friday, and were based at ward level. In addition to the tasks above, they also had additional tasks, which included logging medication near misses and incidents on our electronic incident reporting system, and non-stock medication ordering for the ward. These traditionally, the logging of medication incidents, that task traditionally was held by nursing, medical and pharmacist staff primarily. Next slide, please. So why did we bother? And I'd like to say that it was primarily for the advancement of the pharmacy technician role, but it wasn't really. It was because Ireland, like the rest of the world, is and was facing a healthcare recruitment crisis. So that, coupled with the fact that we now needed much more staff to deal with our increasing numbers in our cancer centre, meant that CHI Crumlin back in 2018 were struggling to fill nursing staff roles for specialist nursing positions. And they heard about a new service at a UK conference where Birmingham Children's Hospital introduced a very similar service to this, where they had pharmacy technicians accompanying nurses at ward level and providing nursing staff with second checks for medication. So our nursing staff were incredibly interested and came back very enthused to Ireland and approach to pharmacy, and they were also very supportive of this new service, and we're excited to see it rolled out. Next slide, please. So my research study was to explore and evaluate the role of pharmacy technicians in supporting the nursing team on medication administration rounds. It employed CFRs, the Consolidated Framework of Implementation Research constructs, to determine the viability of the new service for further expansion and what its limitations were. At this point, I'd just like to acknowledge my supervisors, Dr. John Hayden, Shane Sell, and Eileen Butler, for all their help during the project. Next slide, please. So the research study was split up into 3 work packages: literature review, looking at expanded roles of pharmacy technicians, the descriptive study, which was the activity, so describing the activity and the medication safety interventions that were performed by the pharmacy technicians in their new role, and then the implementation study, which was to evaluate the service amongst its key stakeholders, and it consisted of interviews and surveys. Next slide, please. So just very briefly, the first work package, which was the literature review, we decided to mainly focus on pharmacy technicians advancing into roles outside of pharmacy. So basically, where they were completing a role that was traditionally the responsibility of another healthcare professional other than a pharmacist. There is quite a bit of literature showing the effectiveness of pharmacy technicians advancing into traditional pharmacy-led roles. So this was kind of a relatively new area. So there was 14 studies were included. 9 of these described pharmacy technicians or assistants participating in medication administration processes, 2 comparing them to nurses in completing medication histories. 1 study described the role of pharmacy technicians as process navigators for insurance authorization. Another one about pharmacy technicians assessing medication refill requests at a primary care office, and 1 study reporting on pharmacy technicians identifying and targeting patients needing vaccinations at a medical centre. In fact, all of these studies were based either in the UK or in the US, and this, I suppose, really highlights the pace at which pharmacy technician roles are advancing in states where pharmacy technicians are recognised healthcare professionals and where they have registration and certification. Next slide, please. Next, on to work package 2, which was the descriptive study. So the activity data, so this activity data was collected from the first 6 months after competency sign off for the 2 technicians. So basically we collected all of the, recorded all of the IV medication that they prepared or second checked. We recorded the time it took them to complete them tasks, and all of their calculations were recorded as well and second checked retrospectively by a senior pharmacist. So just to note as well, I suppose that the purpose of the activity study or the descriptive study was not to show that it was more effective or better than what was there existing, which was 2 nurses checking. It really was just to ensure that the service was working and that it was as safe as what was there already. So it showed that 20% of all IVs that were prescribed during the working hours of the pharmacy technicians were 20% of all IVs that were prescribed during the working hours of the pharmacy technicians were prepared or second checked by the pharmacy technicians, which resulted in approximately an hour of nursing time that was saved per day. I suppose at this point, it's important to note as well that this is only the time we could quantify. There was a huge amount of unquantifiable time saved from trying to locate medications. The pharmacy technicians were able to find medications very quickly. If it wasn't there, they were able to order it very quickly and locate it in the main pharmacy for the nursing staff. They were able to field medication queries to the pharmacist quicker. So there was a huge amount of unquantifiable time saved also. and over 99% of all IVs complied with the service checklist. So a very safe service. Next slide, please. They also, along with preparing and second checking IVs, they were encouraged to report medication incidents. So these are not necessarily incidents, in fact, they're definitely not incidents that they were involved in directly, but mainly they reported on near misses and risk issues. So wrong dose prescribed, no frequency prescribed, all of them kind of things. So you can see that post the introduction of the pharmacy technicians at ward level, that the incidents reporting really jumped up. So they were fantastic at reporting near misses and incidents. And equally on the other graph, you can see that they became the main source of reporting for us, which really improved our medication safety culture, because we now had data to back up, that any incidents that we had the pharmacy technicians reporting on them, which was fantastic. Next slide, please. Then finally on to the implementation study. So this study was set up so there was semi-structured interviews conducted by myself. So there was 10 semi-structured interviews in total done with the key stakeholders. So between pharmacy, nursing, nurse management, pharmacy management, along with our champions on the ward, our staff nurse champions on the ward. And then following these interviews, a survey was designed really to triangulate the data that we collected in the interviews and to consolidate that information, and also to allow the wider nursing team to have their say in an anonymous forum. So it was 2 parts, 11 Likert scale statements that were linked to the CFR domains that we assessed in the interviews, and then 5 open-ended questions, which we mainly use for service development. Next slide, please. So these were the major themes that were found during the study. I think from listening to the presentations earlier today as well, these themes are very similar to themes that have come up in a lot of implementation research regarding pharmacy technician advancement, which was encouraging, I suppose, that we're similar to other states. So adaptability, work culture, utilisation of the pharmacy technicians, training and education, medication safety and relationships. Next slide, please. So I'm just going to discuss 3 of them a little bit more today. So adaptability. So as I mentioned earlier, this service was originally, we found out about it from a UK hospital. So it needed to be adapted to an Irish hospital setting, which was incredibly difficult because, as I mentioned earlier, pharmacy technicians remain an unregistered profession in Ireland. So therefore, a baseline set of competencies doesn't really exist for the profession. So we firstly had to define what the baseline set of competencies were, and then we had to establish a training and competency framework in order for them to advance into this new role. So that really held up things in the pre-implementation phase of the project. The different scopes of practice, mainly regarding nursing and pharmacy technicians. So it was a very joint project. We relied heavily on our nursing colleagues to provide the training and education regarding administration of medications. And then current medication policies needed updating. So it is not a legal requirement in Ireland for a double checking process. It is strongly recommended, but our current medication policy in CHI Crumlin was that it would be 2 nursing staff members that would double check medication. So this needed updating. And then finally, from an adaptability point of view, one of the key things that came back from the surveys was that the service didn't really they found that it wasn't as effective as it could be because we only allowed IV medications, which didn't facilitate the current cluster care working environment, which was on our ward. So that was where the nurses would administer IVs and POs to the patient at the same time. So if the technicians could only participate in the IVs, it meant that the nurse still had to get somebody else to check their oral medication. So it was kind of too restrictive, really, in hindsight. Next slide, please. So work culture, one of the main facilitators or drivers of this new service, along with our recruitment issues, was mainly as well around the large workload that the nurses had, particularly in our ward. It was a highly complex ward with very acute patients and a very large IV workload. So there had been multiple complaints from service users, so parents, that nursing staff were always away from the bedside. They could always be found in the treatment room preparing medication. So this was a huge, so the introduction of the pharmacy technicians, really, the nurses just were astounded by the benefits that it had. They all commented on the fact that there was definitely less reduction in stress levels on the ward, and they felt like they had more time for patient care, and they just really found that the whole thing was just incredibly beneficial, and all seeked for it to be extended and extended hospital-wide during the surveys. Next slide, please. Utilisation. So this one was very interesting because during the course of the study, I interviewed some pharmacy or some nurse management in the hospital, and they all commented on the fact that this was the first time they were discovering the pharmacy technician role. So they just didn't know the pharmacy technicians existed within our service, and they were incredibly excited to see what they could do with them next, and what we could do with them next, and where else we could roll them out and how else we could utilise them, because they just really seen the value that pharmacy technicians at ward level could add to our services. In addition, our pharmacy technicians also reported more interesting work with patient focus. So a very successful implementation overall. Next slide, please. And this slide just sums up the positive feedback that we got from the service. Next slide, please. So what did we learn? So these were our implementation lessons. So early identification and management of legal and governance issues. So these will be different in every state, depending on nursing legislation as well as pharmacy legislation. Implement a robust training plan for pharmacy technicians, which aligns with nurse training regarding medication management. So as I said, this was a partnership really between pharmacy and nursing, and neither of us could do it without the other. Consider the current workflows to determine the best implementation plan for the setting. So just really to map out currently what happens. As you've seen, we didn't do that very well, and we didn't identify the cluster care environment that was on our ward. Develop a guideline with clearly defined roles and responsibilities for all parties involved in the process. So this one originated from the theme of training and education. So some staff nurses felt that we didn't provide enough education to the staff nurses as to what their new roles, their new responsibility within the medication management process was going to be. To involve senior leaders on the ward to champion the project, and also then to be mindful of intergenerational, interprofessional relationship issues, which may be overcome by early engagement and involvement of stakeholders. And I think the involvement of senior leaders at the ward level to champion the project really helped us to overcome some of them issues very early on in the project. Next slide, please. So where are we now? The pharmacy technician medication administration process, that service now includes the administration of oral medications. We have one permanent whole-time equivalent senior pharmacy technician. We have funding for a second one, and the project won Best Innovation Award at the Irish Healthcare Awards in December 2022. So we would be hopeful that this will give it a bit of a national standing, and that we can build on this to advance the roles of pharmacy technicians wider across the health service in Ireland. Next slide, please. I think that's it. Thank you very much.
Thank you, Michelle. Also a very excellent presentation, certainly very interesting to listen there. Has anybody got any questions, either for Tara or Michelle or both? Okay, while you think about it, I've got one for each of you. So I'll start with a question for you, Tara. So in my personal experience, organisations seem to find it quite difficult to develop competency frameworks for pharmacy technicians, even when there are existing ones for pharmacists that might be adaptable. You seem to have at least got part way there. Do you find it difficult? Are there any stumbling blocks that you can help us to overcome?
So there's probably two parts to that question. So we have our nationally available vocational training programs, and we do have difficulty with them utilising them in different settings, because there's such a variety of ways of doing even one single thing within the hospital that can be really challenging. They're good programs, but they do require translation for each site. For our internal competency programs, we've done a couple of different things. So here in Australia, for our pharmacists, entrustable professional activities have become the standard training process for our pharmacist workforce. And for our advanced scope roles, when I was previously working in South Australia and now in Tasmania, and a number of other states are doing it, particularly for advanced scope roles, where the role is or where the task itself is the same, regardless of if you're a pharmacist or a technician, we utilise the same training documents. So particularly things like best possible medication history, that activity process is the same process for a pharmacist or a technician, but you stop at a different point based on your scope of practice, as opposed to it being a different process. So I'm all about minimising the number of documents we have to document control. And so we've continued that here in Tasmania as well. So we have a single EPA for that activity, and it's clearly marked what part of that process a technician can be involved in, and what part, or the rest is what the pharmacist can do. So we've tried to do that as much as possible. I think for the general technician activities, so those rotational type activities, that's where it's a bit harder. Probably similarly to Michelle, I think it's just really not. We've historically done a poor job of having those training programs in place. There's a lot of learning through osmosis or teach the teacher, train the trainer type activities, which work really well, but there's not necessarily the foundational documents. And so bringing those in has been challenging. But we have done it relatively successfully. I think in the next 12 months, we'll update those particular training programs to use that EPA framework, because it is a robust way of training people. And so I think the more places we're able to have that, the better. So it's tricky, it's slow, but it's worthwhile. You're on mute, Alison.
Sorry, thank you. We've cracked the foundation training framework, I think, in the UK some time ago. What we haven't yet managed to crack is the specialist advanced consultant level frameworks that our colleague pharmacists in the UK have got. So I think, we're looking to sort of see how other people are doing it. So certainly hearing what you've got to say has been very helpful. Thank you. Michelle, I'm really aware that there's a current conversation going on in Ireland around the potential for registration for hospital pharmacy technicians. It feels to me like all the information you've gleaned from your study could really help to inform some of those conversations. Are you feeding into that conversation already?
Yes, I am aware of it, and I know that it's a voluntary kind of association, because they remain unregistered, who are they're kind of going to our National Pharmacy Registration Board seek help with that. And I've given over my study and any information I have on it to them, and told them that I'm very happy to speak on their behalf or in any conversations about that. But the process is very much so just in its infancy. It's only, the conversations are just starting. So
Indeed,
I think
yeah.
we have a long road ahead of us, but definitely one that's worth traveling.
Excellent. As long as you're feeding in, that's brilliant.
Yeah.
Thank you very much.
Thank you.
Anybody else got any questions for our wonderful
say that's
speakers?
really exciting, Michelle. We're still a way away from registration, I think, in Australia, right? But I think we're starting to get to the pathway to get us to registration. So we'll definitely hit you up for any lessons learned during that process.
I think we'll be hitting you up as well. I think we're behind you. It's just that we're smaller. We're much smaller.
Yeah, it's same, but different. I think.
Yeah.
I think that's the beauty of these types of symposiums. You can hear what other people are doing and then learn from it. And as you say, you know, keep in contact with each other. Are there any more questions for Tara and Michelle? I'm sure somebody must have a question to ask. I can see nothing in either the chat box or the Q&A box. Ryan, I don't believe, there was one, the question that was open seems to have been answered, so that's fine. I was going to say there was one that FIP probably needed to answer, but that's gone now. Have you got questions for each other, ladies?
I mean, I could probably talk your ear off with questions all day, but I'm overdue for bed.
Yeah. You need sleep.
Yeah.
Indeed. So as no one's coming up with any questions, Ryan, shall we move on to whatever's next in the slides? Yep. So you can go on, if you have enjoyed this event, you can go on back onto the events.fip.org and see what else is there that you might be interested in. It may not necessarily be about pharmacy technicians, but there might be other things that you might be interested. But thank you for attending this afternoon, and thank you for those fabulous presentations, ladies.
Thank you for having us.
Yes, thank you very much.
Ryan, you're on mute.
Thank you. I was just saying thank you to all of our presenters and moderators for today's session. Before we wrap up, we do have some closing remarks from Ian Bates and Susan James. We'll start with Ian. Professor Ian Bates is the director of the FIP Global Pharmaceutical Observatory, and I will share with you his remarks, and then we'll hand it over to Susan to close it out. So thank you all for attending today.
My name's Professor Ian Bates. I'm the director of the FIP Global Pharmaceutical Observatory. Congratulations to Susan, Ines, and the team for bringing this together. A great program, I have to say, on collaborative practice, which feeds directly into one of our significant global development goals at FIP. That of working with others in collaborative practice, development goal number 8. This particular mission is creeping up the agenda without a doubt, and FIP is super happy that you've been brought together to discuss the contributions, the significant contributions of the technician and pharmacy support workforce to this global mission. Work is continuing to describe best practice, particularly in relation to primary and community care environments. And although IPE, interprofessional education, and multidisciplinary education, multidisciplinary teams, these are not new concepts. We do have an added impetus right now. We have an anniversary coming up next week for the Astana Declaration FIP is putting on a digital event to celebrate the signing of our pharmaceutical input, our pharmacy input into that significant declaration and a resulting memorandum of understanding with WHO about how and where we can contribute to the global healthcare challenge. And it is a challenge right now. We know that populations are growing older, but they're growing older with more comorbidity and taking more medicines at the same time. The whole primary care situation is getting more and more complex, which means our workforce needs to step up to tackle this. Our latest data shows that we continue to have shortages in the global healthcare workforce, and that includes the pharmacy workforce as well. We'll be reporting soon on our latest surveillance data that we've done, which will include data on the technician and support workforce as well, showing an inequity and inequality about accessing pharmacists and pharmacy technicians and support staff around the world. And that's a serious issue for us all. We will be enhancing our focus on global surveillance, and with the help of Susan and the committee and events like this, we will be able to propagate further data about how we are all in the pharmacy family contributing to this problem. And certainly collaborative working is one major policy route that we need to explore. So I'm sorry I can't be with you, but rest assured FIP remains committed to supporting and developing the advisory committee under Susan's leadership, and Ines as well from FIP, who is supporting this important component of our mission, of our workforce mission. And we will continue to push forwards. There's been remarkable achievement from the whole PTAC team, and I applaud you for continuing this important work. We're recently back from Brisbane from the FIP Global Congress, where we held a symposium, a workforce symposium, the first real focus since Nanjing 2016. We've been working really hard since Nanjing. We've changed our mission profile, our mechanisms, our systems significantly as we move towards this WHO target of 2030 in order to tackle workforce issues. One of the key outcomes of the Brisbane Symposium, the 2023 Brisbane Symposium, was a set of action points, a call for action, which currently is moving through Bureau now at FIP to be endorsed and soon to be published within days, in actual fact. Commitment number 4 of our outcomes from Brisbane was all about collaborative working. Let me read it to you to show you what's coming out. It's to develop, it's a call for action to develop guidance on best practice and case studies, and to describe case studies that will describe skill mix optimization for pharmacy teams in all sectors, but with particular reference to primary care settings. So that's a commitment we're about to make globally and publicly about how we can continue to develop the teams within FIP with your involvement and your encouragement in order to tackle headlong our workforce challenges and our primary care challenges. So congratulations again on a super conference. I hope you've all enjoyed it. And I hope it's going to be a very rewarding experience to think about the aftermath, what you produced, where you want to go, and Susan's continued leadership on that. So back to you, Susan. And I look forward to meeting up with you to talk about the outcomes and our refreshed mission plan up until 2030. Bye for now.
Hello, everyone. My name is Susan James. You've heard from Ian. Although Ian's not able to be here, certainly would have been wonderful for him to join us and for any of you to be able to ask further questions about the work that Ian just spoke about, but certainly thank him for taking the time to be with us virtually. I don't know how many of you have been here for the full 2 days of our symposium. Just to introduce myself again, to those of you who may not know me, I am Susan James. I am currently the chair of the Pharmacy Technician Advisory Committee within FIP. For those of you who don't know me otherwise, I am a regulator. I am the Director of Quality for the Ontario College of Pharmacists, which is not an education institution. When we refer to colleges, we are talking about regulatory organizations, and I have the pleasure of being within a regulatory organization that does fully register pharmacy technicians to the full extent that we do pharmacists, and very fortunate to be within a country in Canada where we actually see that is the case across the country, as it is in some other locations. I am first off wanting, there are a few things that I want to just take a few minutes before we sign off on the symposium to talk about. I want to acknowledge yesterday, I introduced the session by starting with a congratulations of International Pharmacy Technician Day. A couple people referenced that today. It is only a day ago that we had that, and we have intentionally planned our symposium around that particular event. It is a great opportunity for all of us to celebrate pharmacy technicians, assistants, the pharmacy support workforce, whatever title you go by, and to truly acknowledge the contribution that this workforce makes to not just pharmacy, but to our entire healthcare system and services to the public. So congratulations to all of the work that you all do. I think that we've had 2 days of true demonstration of that contribution that we are seeing within the workforce that the pharmacy support, the pharmacy technician workforce contributes. And I have to say, I have been working with FIP in regards to pharmacy technician workforce since the organization truly began with a symposium in 2012. Where it was the first time that as an organization they had fully recognized and wanted to begin to celebrate and allow opportunities of a coming together and promoting, talking about how to further advance the workforce. So we are now over 10 years in doing that, and certainly listening to the sessions today, how far we have come. It is so exciting. One of our speakers today started that session with let's get excited, and how exciting it truly is, the advances that we have seen. And not to say that there aren't many more things and work to do, but I do think that sometimes we need to pause and reflect back. And I am always so delighted when I can do that and see how far we have come. And I think we've had some great presentations around that. I want to thank all of our speakers and our moderators for the time that they've taken to share with you the work that they are doing and to give you that opportunity and view into what is happening globally in this space. And likewise to thank everybody who has taken time out of your schedules to join us, to absorb so much information. I do encourage you to please share that information. The session is available if you yourself weren't able able to hear all of the presentations, if you weren't able to attend yesterday, know that it is all there available for you, for yourself to observe and for you to pass on to others. There are many people here through the comments that I believe want others to hear about what is going on, and this information is all there for you to share, so please do so. I'm not going to take a lot of time to go through. The sessions are there. There are so many wonderful things that are happening and important messages for us. If you weren't at yesterday's session, we started with a conversation about a new organization that has been established in the UK, the Pharmacy Technicians of Color Group, a wonderful session talking about the importance, that the unfortunate realities of inequalities that we see, not just within pharmacy technician, but really a session that well worth anybody observing to understand. It's a great example. There is lots of information, data about what are some of those inequalities and the impact of those inequalities within the pharmacy technician space, but certainly much there for all of us to learn. It's something that cuts across the globe, and I really would encourage people to listen to that, to learn, to understand. It is a session that does talk about how each and every one of us, regardless of color, of role, where we are in our own individual spaces, have something to think about and to learn from and to work on with that regard. So I encourage you to do that. I also just want to note the other session yesterday was something that was organized particularly by the Pharmacy Technician Advisory Committee, reporting on 2 of our core pieces of work. And they really are critical activities that we are engaged in. Again, I think many of the questions, some of the comments that are coming up, particularly from those of you who are interested in either how to evolve the pharmacy technician role, particularly towards further education, career development, recognition, registration within your countries, and those of you who are looking at what that might look like in terms of moving from your current jurisdiction to another jurisdiction to be able to work. These 2 projects lend themselves very much to that effort. The first is a glossary project, and it really is just that, the development of a document that defines a number of terms that are relevant within pharmacy, within the pharmacy workforce in particular, and just those very things that we are talking about: scope of practice, education, competencies, many terms that have extensive variability internationally, globally, in terms of how we use those terms. The term pharmacy technician itself is not consistent globally. There are many different terms that are used, and as you have seen today, a pharmacy technician in one space, that might be within a particular organization, within a small community, a jurisdiction, a country. It can vary greatly in terms of what is the scope, what is the meaning of that. Much more so, not to say that that's not true with pharmacy, with pharmacists, but it is definitely more variable at the moment for pharmacy technicians, assistants, the support workforce, which is why we sort of use all of these terms. The glossary is intended to try to define these and to understand what the different terms mean in different jurisdictions, so that we can all have a greater shared understanding of what we are talking about, and to begin to move us towards some common language. The other project is a competency framework, and many references today to the competencies, to the importance of a competency framework. Again, particularly those of you that are asking questions about, how do we evolve things, what needs to be done in terms of moving to another jurisdiction. The importance of us developing a competency framework that is specific for pharmacy technicians is so that educators, regulators, employers, governments, administrators, individuals themselves can understand what are the knowledge, the skills, the behaviors and attitudes that make up this profession, And so that, again, we can have some understanding, and as people move from place to place, we can all focus on a common framework to understand where you are, what that scope of practice might look like, and from a competency framework, as I said, to be able to then define what are the education, the training, the knowledge base that might be associated with that. So it also is a very important project. Both of these initiatives are well underway. You could go back to those sessions, hear about them, and know that we are looking forward to moving them forward and getting them out publicly next year. You've heard the sessions today, some wonderful, wonderful messages. So exciting to see where things are moving within this pharmacy technician space. I want to just wrap up by encouraging anybody who has joined us that is not yet a member of FIP. I would encourage you to think about becoming a member of FIP. There are many, many tools, opportunities, ways to connect, ways to get involved in the organization. And I want to call out that FIP has been for a long time very committed to the integration, the understanding of the full pharmaceutical workforce. You heard Ian reference the Nanjing conference, and in 2016. Many of you may not have even been aware of that, but one of the very important things that came out of the Nanjing conference was a very clear definition of the pharmaceutical workforce, and a clear recognition that that workforce includes the pharmacy technician and pharmacy support workforce. So that was very important. FIP encourages everybody to become members. You are welcome to become involved in various activities. The Pharmacy Technician Advisory Committee is a good example of that. We continue to welcome additional individuals to join us. It is not something that is exclusive in that sense. If you are interested as a pharmacist or a pharmacy technician or any other related role to advancing the work of the pharmacy technicians, to want to provide guidance, support, your contribution to the work that is being done at FIP, we welcome you to put your name forward, and we will be in touch in terms of joining the work that we are doing. One final note on that, we are a group that has both pharmacists and pharmacy technicians. You've seen the combination of both parts of the profession within the sessions that we have had here today. And again, I want to just reiterate, and Catherine Duggan, the CEO of FIP, spoke to this yesterday as well, the importance of coming together, working together in partnership, in collaboration. It is one of our very common themes. This is not just about pharmacy technicians being members of the committee, but recognizing that we are a team. It is a partnership. You've seen presentations, the pharmacists that are contributing in this space that are certainly helping and advancing the work that we are doing in so many important ways, yet encouraging, allowing, enabling our pharmacy technician partners to really achieve what they can to that fullest scope as well. And there really is no limit to what that looks like, as you can see from so many of the people here who are pharmacy technicians and doing, Allison, moving on right now, looking at a PhD program. There is no limit and no distinction in that regard. And so I do just want to encourage again that we are, Catherine says often, standing shoulder to shoulder. We are one team, and I think you've seen some very good examples of how that works and the contribution and the greater contribution that we can make together when we do all work together. So with that, I am going to conclude our session. Thank you all again for attending, and please share the words that you've heard, the information that you've gained, and know that there are many more sessions. The PTAC does provide further sessions throughout the year. You can watch for those and know that there are many other opportunities with FIP to get involved. Thank you. Thank you again to all of our speakers, moderators, and to all of those of you who have joined us today. Thanks very much. Bye for now.